My name is Anja Hayes, and as the Fogarty Program Official overseeing the Global Health Fellows and Scholars Program, it is my pleasure to welcome you to our celebration of its 20th anniversary. So we are so excited to have you all here today, not only to join us in celebrating the program's many accomplishments, but also to hear your ideas on how the program can best achieve its 4 goals of fostering the next generation of global health leaders, strengthening global health research networks, further enhancing research capacity in low and middle income countries, and also expand access to global health training and research to individuals from diverse backgrounds. As you can see from the handouts, and also is available online at the website above, we have quite a lively agenda lined up for you this morning. In addition to my brief overview of the Fellows and Scholars Program and remarks from a few notable voices, we will hear about the experiences of former trainees in 2 panel discussions. The first panel takes advantage of panelists' recent participation in the program as they continue to navigate their career paths. The second panel brings together former trainees who participated during early years of the Fellows and Scholars Program, some of whom have returned to serve as mentors. And for both discussions, they will both be moderated by leadership from some of the program's biggest NIH partners. And although we invited the panelists to share their experiences and ideas, I also want to encourage everyone to contribute to the conversations. For both panels towards the end, they will conclude with a Q&A session. You will also see on the agenda that there is a coffee break scheduled between panels, during which time I encourage you to meet up with old friends, as well as use this as an opportunity to make new connections. And so now for a brief overview of the program, considering that many of you may only be familiar with parts of the elephant that we call the Fellows and Scholars Program. So 20 years ago, Fogarty set out through the Fellows and Scholars Program to create a strong community of global health researchers from the U.S. and LMIC who work together as equal partners to impact global health. From the very beginning, the Fellows and Scholars Program has provided individuals from the U.S. and LMICs with 1 year of mentored research training. The mentoring has been provided by experienced U.S. and LMIC researchers at well-established research institutions and project sites in the LMICs. And the program has supported research in a broad range of areas, although early on, most of the research focused on HIV and other infectious diseases. But the program has seen a few changes over the years. Although widely referred to informally as Fellows and Scholars, this program actually has had several official names over the years. The program began as the Fogarty Ellison Overseas Fellowship in partnership with the Ellison Medical Foundation. And this cycle of the program offered mentored research training to medical and public health graduate students. It was in this cycle of the program that there was a twinning of the U.S. and LMIC trainees, meaning the U.S. and LMIC trainees with particular research interests and at similar points in their careers were paired during the 1 year of mentored research training and on the research projects. And in 2007, when the program became Vickers, Fogarty funded a resource and support center to take over the many administrative responsibilities of this program. Vanderbilt University, under the leadership of Dr. Sten Verman, successfully competed for the award. It was during this cycle that postdoctoral trainees became eligible to participate. Fogarty also partnered with the United States Department of State to offer more opportunities for U.S. graduate students to participate in the training with the Fulbright-Fogarty Fellowship in Public Health. In 2012, the program was restructured into a decentralized consortium model. Each awarded consortium reflected a network of established research collaborations between faculty at 4 U.S. institutions and their research partners in LMICs. Each consortium developed its own research training program and oversaw its own administrative responsibilities. The awarded consortia were GHES, GLOCAL, NPGH, UJMT, and VECTED. So there's so much more to the programs, and more information is available not only in the booklet that you received today, but also additional material that's provided online. So I encourage you to check those out to learn more about the awardees. When the program was recompeted in 2017, the number of consortia increased to 6 with the addition of HBNU. And last year, when recompeted yet again, 2 new consortia joined, Insight and Achieve. We also used this opportunity to change the official name of the program to Launching Future Leaders in Global Health Research Training Program, or LAUNCH for short. And for this cycle of the program, eligible trainees are doctoral students from the U.S. and postdoctorates from the U.S. and LMICs. This cycle also ushered in a reciprocal short-term research experience in the U.S. for the LMIC trainees. Now, over the past 20 years, the program has greatly benefited from the shared commitment of our NIH ICO partners to prepare the next generation of researchers around the world. 25 NIH ICOs have provided funding to cover the cost of training graduate students and postdoctorates from the U.S. and LMICs. Demand for this program exceeds the number of training slots covered by each grantee's annual budget. However, with the support of our NIH ICO partners, the Fellows and Scholars Program has been able to reach many more outstanding individuals who otherwise would not have been able to participate. The Fellows and Scholars Program started with a cohort of 35 individuals in its first class. And for the past few years, with the support of our ICO partners, the cohort size has grown to over 100 annually, I should say. And with the help of all our partners and grantees, the Fellows and Scholars Program has provided research training to about 1,500 trainees at 133 research institutions and project sites in almost 50 countries around the world. And there's so much more to this program and the grantees that could not fully be captured in this brief overview. But more information is provided online and in your booklet. So as I mentioned before, please check it out. But I would like to end by celebrating the contributions of 2 global health leaders and mentors in the Fellows and Scholars Program, Lee Riley and Charles Vanderhorst. Their research had a profound impact on global health, and their dedication to teaching and mentoring helped shape the careers of many trainees, including some in attendance here today. And so now it is my pleasure to introduce our keynote speaker. In addition to the impact of his research on the lives of many around the world, our next speaker led the Fogarty International Center as its director from 2006 until just earlier this year when he stepped down and became Senior Scientist Emeritus. So please join me in welcoming Roger Glass, who has been the Fellows and Scholars Program most dedicated leader and passionate champion.
Thank you very much, Anja, for getting us going. There's a lot of energy in this room. I could see when you came, and I've seen people I haven't seen for almost 20 years. So I hope that the networking events and really the dinner tonight will bring us all together to have real in-person communication. But I'm delighted to be here. And having been the director of Fogarty for 17 years, I've gotten to know about 1,200 of you fellows individually when you came. So this is a great experiment for me to see what's happened to you in the last 20 years, to see if those students who were here 20 years ago have really pursued global health, and if the students are as valuable as the fellows in terms of the training opportunities, whether the foreign fellows are equally satisfied with the experience and whether and how we're changing this. So there are lots of things that are going to go on with the program. And one of the reasons I could step down is because there's so many qualified people at Fogarty now who have picked up on this, starting with Peter Kilmarks, who's the acting director now and has been with us as deputy for many years and is highly esteemed by the group. And also we have Millie and Yolanda Thomas, who have been with the program from the very beginning, behind the scenes. And we wouldn't have that lovely breakfast and dinner tonight without their help. So I just want to give a round of applause for Yolanda. Where are you, Yolanda, if you're here? Millie? And the staff, we've been planning this event for a year, and the planning group includes our communications group, Judy Cohn-Stevens, Mariah Felipe, and the group in communications, Anja, and the group Flora Katz and Millie and Ditter, Yolanda, who's done all the administration, and Celia Katz, who's done the evaluation and all the data that you've seen from a survey that she'll be telling you about, I guess, on Saturday. So I'm delighted to be here. I want to the program really began with Aaron Primack, who's in the audience, and Pierce Gardner, who's on the phone. I wanted to give Pierce just a word of thanks if he's on the phone. Pierce, are you there? If not, I want to give Doug Heimberger a word from the second cohort, because Doug did the evaluations, and I asked him to give us 3 key points of the first evaluation. Doug, can you just stand up and yell out, or come up just quickly? Doug, come up, just there it is.
We're trying to get Pierce back.
Okay.
Greetings. Okay, is this on?
Yes.
Thank you very much. I didn't know when you would be calling on me, but we were at Vanderbilt Institute for Global Health. We're pleased to lead a number of publications evaluating this program over the course of the years. But what you're wanting me to comment is the paper that just came out, right, Roger? Mm-hmm. So just last week we published a paper. It was posted by the American Journal of Tropical Medicine and Hygiene as a first ever survey of the LMIC hosts from this program. So we surveyed, we had 89 responses from 31 countries of people who have hosted the fellows and scholars, both American and LMIC fellows and scholars of this program between 2012 and 2021. And it was a mixed method study, both quantitative and qualitative. And the results, I'm pleased to say, were really very positive. We asked them a lot of questions about how has this program impacted you and your institution in your career? How have the fellows and scholars contributed to your institution? Have they conducted research in areas that are relevant to the needs in your area? Have they been responsive to you as mentors? Have they stayed in contact with you in various ways over the years since they finished their training? And the answers to virtually all of those questions were strongly yes. The respondents felt as though over the years not only had the fellows and scholars contributed, but simply being able to manage the grant funds that come along with them and other aspects that Fogarty has provided have improved the institutional capacity to manage grants and to really work within this space. So they seemed grateful for that. And they did mention a couple of areas for potential improvement, which I think those of you who lead launch programs, consortia, might need to be aware of. And that is, I think some of them were asking for slightly more comprehensive engagement in the process, including the selection of scholars, as well as really consistent feedback and evaluation processes after the fellows and scholars had left. So they really want to be more engaged, I think, and I think their institutional capacity they felt had been really built through this program, and by and large they've really said they've been glad to participate in it. Yeah.
Great, Doug. Thanks. And Doug's written a half a dozen papers on the fellows and scholars that are all available. So thank you, Doug, for that survey help. What's been interesting to me in my tenure at Fogarty has been that when I started, global health was really solely or uniquely in infectious diseases in the ATM machine, AIDS, TB, and malaria, and not really diverse. And over this period of the fellows and scholars, we've gone out to recruit people in all aspects and all areas of biomedical research so that all the institutes can see value in the people we've trained. And I'm delighted to see so many of you here who have been picked up by the other institutes and started to grow fields like global cardiology, global diabetes, global neurology, global rheumatology, global ophthalmology and dermatology. So representatives and global cancer, they're all there. They're all there. And I think you people are the next line of future leaders in those professions. And I see many of you in global health departments and academic settings in the U.S. And this is terrific. You're going from fellows to leaders in areas of global health that were never appreciated before. This is the difference in the 21st century, and we're still growing. We had an architect, we've had people from in data science, things that are unique for the 20th century. So I'm looking forward to hearing from you, and we have panels set up so you can give your stories. But many of the stories you'll be able to tell us during the networking meetings and the events on Saturday. So with that, I want to really end early so the panels have a chance to have their full time. Maybe the panelists could come up right now while I'm speaking and just close by saying how excited we all are to see you after all these years. We've had over 700 responses to the surveys, and this is our first chance to see if this great experiment of sending you out into the world after a year or two of training has really impacted your careers, and if so, how. So with that, I want to give an applause to all of you for coming back and joining us. I want to point out Yulin Xiao, one of our visitors, our mentors from China, who's with us and who's had more than 24 fellows in China over the years. And he met with Harold Varmus when he went to China, and there were 12 fellows in his program in the Chinese Institute, Cancer Institute of Chinese Academy of Sciences. So Yulin, welcome as well with your group. Nice to see you all. Thank you. Let's have the next panel come up and get started right on time. Thank you all. I look forward to speaking to every one of you here. And George and Leonardo, then and now, moving beyond early careers. And I must say, George has been an incredible supporter.
Right behind you.
There you are. Step up to the plate here.
Good morning, ladies and gentlemen, and good afternoon to those of you who are joining us virtually. My name is George Mensah. I'm from the National Heart, Lung, and Blood Institute, where I serve as the director for the Center for Translation, Research, and Implementation Science. My role here this morning is to serve as a co-moderator, and I'll be calling on my partner to introduce himself, and then we'll begin with the panel. But before I do that, I really want to call for a real strong round of applause for Dr. Roger Glass, whose personal commitment, his passion, his friendship, and his support has really helped grow the global health program, at least in my institute, and then I know in several other institutes. So, Roger, thank you very much. I'm not sure where Roger is. I certainly also want to thank Dr. Peter Kilmore, Dr. Anja Hayes, Yolanda, and the wonderful team at Fogarty who's really made this possible. Now, we are very fortunate because we have 8 outstanding former fellows and trainees who have promised to each spend no more than 3 minutes to share with us their program. So again, welcome to this very first panel. There's a second panel, but this panel is dealing with then and now and how we move beyond early career. So I'll call on my colleague, Leo Cubillo, who's my co-moderator.
I'm going to speak from this microphone. Good morning, everyone. I am Leonardo Cubillos. I direct the Center for Global Mental Health Research at NIMH. And on behalf of Dr. Joshua Gordon, the director of NIMH, and all my NIMH colleagues, I really want to thank for this invitation, and most importantly, to extend a word of congratulations. Closer to the mic? Is this better? Thank you. On behalf of NIMH and Dr. Joshua Gordon, I want to extend a hearty congratulations to all our Fogarty colleagues, Dr. Roger Glass, Dr. Peter Kilmers, Yolanda, and all the staff involved throughout these 20 years in the now called launch program. NIMH has been fortunate to partner with this program since 2007, and we have had the honor to support over 50 of the fellows and scholars, many of them who continue to be active and leading the field of global mental health. So without further ado, I'm going to invite our first speaker of today. I think your line in alphabetical order from the end to my right, Dr. Anuba Agarwal, and I will apologize in advance if I mispronounce your first or last names. Please don't call me on that. Dr. Anuba Agarwal, who is Assistant Professor and Co-Director of Global Health Cardiovascular Program at the Washington University. Her CV is in page number 9 of one of the booklets. Dr. Agarwal, take it away.
Thank you very much. So as mentioned, my name is Anuba Agarwal. I'm a cardiologist and an assistant professor of medicine, as well as co-director of the program in global cardiovascular health at Washington University in St. Louis. Is this better? I had the privilege of being a Fogarty Fellow from 2017 to 2018 based in India, where my mentors were Dr. Dhuriraj Prabhakaran, who's Executive Director of the Center for Chronic Disease Control, and Dr. Mark Huffman, who's a cardiologist and colleague of mine now at WashU. My research that year was focused on improving heart failure care in Kerala, and I continue to work in Kerala, South Asia, and Sri Lanka on improving heart failure care by developing a novel implementation strategy of a polypill for patients with HFrEF, and fortunate to be funded by a K99 R00 through NHLBI.
We're going to do our best and encourage everyone to come as close to the microphone as possible. I actually didn't hear when she finished. So, our next speaker is Dr. Roxana Garcia. She's an assistant professor of neurological surgery at Northwestern University. Dr. Garcia, please go ahead.
Good morning, everybody. My name is Roxana Garcia, and I served as a Fogarty Fellow through the HPNU Consortium between 2019 to 2020. I worked with my international mentor, Patricia Garcia, and Mamta Swaroop, who is a trauma surgeon previously at Northwestern, on a surgical capacity evaluation of basic and essential surgical care throughout the whole country. We did a very basic needs assessment of the public sector, and I traveled the whole country evaluating and trying to identify interventions to improve neurosurgical care for the public sector. And many of these activities had led to blossoming in my career early on, and on the pathway to applying for NIH funding to further initiatives related to traumatic brain injury and also spina bifida for children suffering from myelomeningocele.
Thank you very much, Dr. Garcia. Our next speaker is Dr. Yvetot Joseph, who is a research physician and research coordinator at the Geishkio Centers in Haiti. Dr. Joseph, your turn.
Good morning to everyone. Thanks again to be part of this excellent panel. So as mentioned, I am Yvetot Joseph. I'm working as a research site coordinator at Geishkio in Haiti with my mentors, Dr. Pab and as well Dr. Fitzgerald from Cornell. And I did my Fogarty Fellow, it was in 2018 to 2019. I got two main research focuses. The first, it was about the impact of TB on long-term mortality among HIV-positive population. And the second is the human factors among HIV population with recurrent TB. The first that showed that people with past history of TB more twice than people that never got TB. And the second that we are still working and we are still enrolling on it, but we are looking at about the immune factors for that show people more at risk to have recurrent TB than others. And I wrote a lot of my Fogarty training, and on that I daily make practice of all the concepts that I learn, and this is a very good pleasure to be part of this panel today. Thank you.
Thank you very much, Dr. Joseph. The next presenter is Dr. Ashley Krasuski from Indiana University, which is part of the Northern Pacific Global Health Consortium, and her work is around improving the oral health of Kenyan teens living with HIV. Dr. Krasuski?
Dr. Krasuski, you may want to...
I'm not sure. Okay, there we go. Thank you. So my name is Ashley Karczewski, and I'm a dentist. I'm currently a dental resident focusing in oral oncology at Roswell Park Comprehensive Cancer Center in Buffalo, New York. And while I'm completing my residency, I'm also working as a research assistant at the University of Washington School of Dentistry Global Oral Health Center, where I help with the HIV study design, development, implementation, and data management, especially with REDCap. And I was fortunate to go to Peru in 2022 for another HIV study. So I was the first dental student to complete the Fogarty program, and I completed it between my second and third years of dental school at Indiana University. I was part of the 2019-2020 cohort, where I was working with Dr. Ana Lucia Seminario and Dr. Arthur Comoli, who are both pediatric dentists working in global oral health. I was in Nairobi, Kenya, where I joined the Children's HIV Oral Manifestation Project, also known as CHOMP, where we were evaluating the relationship between certain components of innate immunity, mostly salivary antimicrobial peptides, and how these values can correspond with oral diseases in children and adolescents living with HIV in Nairobi, Kenya.
Thank you very much. Our next presenter is Dr. Andrew Kim, who is an assistant professor at the University of California at Berkeley, where he teaches a course on Introduction to Biological Anthropology. Dr. Kim, please.
Hi, everyone. Thanks so much for having me. My name is Andy Kim. I'm an assistant professor in anthropology at UC Berkeley, and also an honorary researcher at the University of the Witwatersrand in the Faculty of Health Sciences in Johannesburg. I was a Fogarty Fellow in 2019 to 2020 with the HPNU consortia. I had a really wonderful time with my colleagues, and my primary mentors were Shane Norris at WITS and Chris Kuzawa, my PhD advisor at Northwestern. My Fogarty project was twofold. My main primary project was on the intergenerational effects of trauma that pregnant women experienced during the dissolution of the apartheid regime in a 3,000-person longitudinal birth cohort study called Birth to 20, now called Birth to 30, because the participants just turned 30 years old, and the potential ameliorative factors that could undo the effects of past inherited trauma. During 2019 to 2020, of course, something called the COVID pandemic hit. So I shifted my research to also evaluate the mental health impacts of the COVID-19 pandemic, and also looking at impacts on psychiatric care provisioning in the tertiary psychiatric care system. And I've since continued that work to try to understand the underlying biological mechanisms that affect the psychiatric sequelae of long COVID in both HIV and people living with HIV and people not living with HIV. Thank you so much for having me.
Thank you very much, Dr. Kim. Our next presenter is Dr. Joseph Matovu, whose institutions Yale and Makerere University School of Public Health. Dr. Matovu is going to address the work in HIV self-testing in a Ugandan fishing community. Dr. Matovu.
Thank you. As introduced, I'm Dr. Joseph K.B. Matovu. If you have to read more about me, look at page 34. That's where part of the work is described. I am based at Wisitema University, Faculty of Health Sciences, and also Makerere University School of Public Health. I was a fellow in 2018-2019 under the Global Health Equity Scholars Fellowship Program, and my mentors were Professor Ann Kuth from Yale School of Nursing and also Professor Rhoda Wanyenze from Makerere University School of Public Health. Both of them were deans and still are deans of the respective schools, so I happen to be mentored by two deans. My project focused on HIV self-testing in the fishing communities and focused on men. Men in the fishing communities are highly mobile, and it is very difficult to get them into care. So we worked closely with social network groups of men within the fishing communities, identified and trained men to distribute HIV self-test kits to fellow men, and then we measured and identified that 95% of the men that actually received the kits used them to test for HIV, and those that tested positive, about 7% of the men, 90% of them linked to HIV care. So this approach was taken forward, and my current research is still continuing with HIV self-testing in the fishing communities to improve HIV testing uptake, linkage to care, and then following up with retention in care in these highly mobile fishing communities. Thank you very much. That's all.
Thank you, Dr. Matovu. Our next presenter is Dr. Siana Nkia. Dr. Nkia is the Senior Lecturer of Biological Sciences at the Muhimbili University of Health and Allied Sciences in Tanzania. Dr. Nkia's profile is on page 49 of our booklet. Dr. Nkia, your turn. Thank you.
Thank you very much. Good morning, everyone. I thank the organizers for having me here today. As introduced, my name is Siana Nkia. I'm a senior lecturer in the Department of Biochemistry, Muhimbili University in Dar es Salaam, Tanzania. I'm also a founder and the president of the Tanzania Human Genetics Organization in Tanzania. Sorry, can you hear me now? Yes. So, senior lecturer at Muhimbili University, Department of Biochemistry. I'm also a founder and the president of Tanzania Human Genetics Organization in Tanzania, and I've worked very closely with the sickle cell program in Tanzania for more than 10 years now. So professionally, I'm a human geneticist, and my passion on research is really to utilize human genetics to improve healthcare in three main ways. One, diagnosis and screening. Two, disease modifying and monitoring. And three, pharmacogenomics. My focus of research has been on sickle cell disease because I believe it's a good genetic disease model. So I think I count myself blessed and lucky to have gotten support from NIH through the Fogarty International Center and NHLBI at two levels. First, as a Global Fellow in 2016-2017, where I was supported to continue my PhD work looking at the genetics of fetal hemoglobin. This was really important because, one, fetal hemoglobin is a major modifier of sickle cell disease, and two, because it is genetically influenced. So through the support in GLOCO, I could look at the genetic and epigenetic markers associated with extreme levels of fetal hemoglobin in individuals with sickle cell disease. And in 2019, I got support through the K43 program to, for the first time, to establish a birth cohort of babies with sickle cell disease and without sickle cell disease, and really with the aim of looking at the disease progression in relation to the time point, rate and pattern of fetal hemoglobin decline and the genetic determinants. I have been very lucky to be mentored by well-renowned scientists, Professor Julie Makani from Tanzania and Professor Solomon Oforiakwa from Pittsburgh and Ghana. Thank you very much.
Thank you very much. I'm so glad that you mentioned Dr. Julie Makani. I'm sorry that she's not here, but hopefully she's watching earlier today, but thank you. We have one more presenter, and before I call on him to present, I really want to encourage all of you. We've saved enough time for Q&A, so we'd love for you to ask your questions to the panelists, to any of them, and so that we have a very rich dialogue. The final presenter is Ivan Segawa, and his institutions, the University of Washington in Seattle, and with a foreign institution being the Global Health Uganda, the College of Health Sciences, Makerere in Uganda. Ivan, go ahead.
Thank you. And thank you for pronouncing my surname well. My name is Ivan Segawa. I'm a junior research scientist and research fellow at Makerere University. I was privileged to do my Fogarty under the NPGH, and I was funded by the National Institutes of Nursing Research. My project focused on nurse-led PrEP delivery among adolescent girls and young women. And first of all, I'd like to say it's an honor for me to be here and to see many of the people in person, Roger Glass, and Joe, and everyone from the NPGH family. And part of my cohort is also here. I'm super excited to see them. But I'm also grateful that my project projected me for where I am currently. I work under the Mosaic project at FHI 360, and we are testing the feasibility of enhanced packages of PrEP choice. We're working with adolescent girls and young women, and we are trying to see whether the uptake and how they're using the expanded choice of the PrEP, oral PrEP, the injectable, and the ring. And for me personally, and from the funding I received to continue my work, I'm really passionate about HIV research, HIV prevention research among young women who are the drivers of the HIV epidemic in Africa. I'm also grateful to my mentors who have really shaped me to where I am today. Dr. Andrew Mujigira from IDI Kampala and Professor Renee Heffron, who is at the University of Alabama. And yeah, that's all from me. Thank you.
Thank you very much, Dr. Segawa. I have a question for Dr. Agarwal, if I may. In your profile, there is a quote from you that says, "My Fogarty year was the most impactful year of my life, both personally and professionally. It can be difficult to take a year off for your study when you are on the physician track in the U.S., but you never know where it can take you." Dr. Agarwal, I found that quote very, very, very enlightening in many ways. And I would like to ask you, what do you think has been the impact of this program in your career as a global health researcher thus far? Thank you.
Thank you very much for that question. There's so much to say, but I'll keep it brief. I think professionally, my Fogarty year was incredibly transformative. The ability to have the opportunity to live in India for a year helped me develop relationships with colleagues, which have been transformative for my career as an early faculty member. The data that I collected during my Fogarty Research Fellowship formed the basis for my K99 R00 application. And I think personally, the year was incredibly transformative as I met my husband during my Fogarty Fellowship, and we just had our first child 3 months ago. And so, needless to say, my Fogarty Fellowship has been both professionally and personally incredibly rewarding. And I look forward to kind of giving it back to future Fogarty cohorts as I transition to being a mentor myself.
That's wonderful. Thank you. We tend to always focus on the clinical and the public health aspects and impact of this work. But as you just heard, there's a lot more from this fellowship. So thank you. You know, I was really very impressed with Doug's presentation of the survey of the host institutions in terms of what they thought we would be doing. If I remember correctly, there was a strong focus on engagement, and another strong focus on the need for feedback. I suspect there must be others, so I really want to ask our panelists, given your experiences with your host institutions, what else beyond the engagement and feedback would be really critical? And this is to any one of you. If you want to chime in, get close to your microphone and share with us, beyond engagement and feedback, and I haven't read the survey yet, but what do you think were the most important from your relationship with your host institution?
To say a couple words around this. So one of the things I really loved about my year in Lima was not only my opportunity to meet the people that I was working with directly, but the ones that I knew were related to my area of interest. And, you know, I think most of the sites that the fellows get to go to, there are just so many people to interact with. I would say one thing that I would love to see more of is cross-pollination. Maybe not so much forced, but encouraged interactions with people that you may not think are related, but maybe are, or really engaging even people below you who are interested in similar work but don't have as much mentorship or direction, I think would be something that I would love to see more of. I tried to do as much as I could while I was there, and some of those relationships continue to blossom, but I think that that would be something that I would love to be part of, even early in this career process that I'm in, just to encourage the future generations to continue to grow within global health in all disciplines.
Great, thank you. Any others? Right. We can turn to the audience as well. We have 2 microphones in the hallways here. If you have any question, please just come up so that we will see you and we'll recognize you. Wonderful. We have one question on the right.
Hi, my name is Stan Vermund from Yale University. Ashley, the world of oral health. If we see anything that's neglected in low and middle income countries, it's oral health. And I think whether you're a cardiologist or a rheumatologist, there are all sorts of implications to general health. But it's even in the United States, it's estimated the #1 unattended health problem of children is oral health. I was in Nigeria perhaps a decade ago, and I met a well-trained dentist who was at a clinic where her equipment hadn't been set up. And she was literally looking in people's mouths and pulling teeth. That was what she had to offer, and yet she had a full array of equipment that had not been set up, the drills had not been established, et cetera. How can we bridge this, this gap capacity gap for oral health. Is there an implementation science agenda for launching oral health programs? The book Where There Is No Dentist. Can you comment?
So within the United States, that's something that we still see. So we have these federally qualified health centers, and those are kind of examples where we have limited resources, but we're still trying to reach these communities. And I know that the WHO and the Lancet, they published the recent directives for the oral health implementation. So we have those guidelines that can help follow us. But I think one of the other most important things is just bringing dentistry to the same table as medicine. And that is what I hope to do with my career, is to integrate dentistry into medicine. I'm doing that with my residency at a cancer center right now, and then while also working with the University of Washington for the Global Oral Health Center. So I think being able to bring some of these initiatives that we've developed in these lower resource settings in the United States, kind of learning our lessons from there in order to help carry that over to LMICs is going to be really important. Yeah. The Global Oral Health Center is started by Timothy DeRuin, who was one of the first global oral health researchers. And that is at the University of Washington, and now it's kind of taken over by Ana Lucia Seminario. We have different studies that are going on in Peru, in Thailand, in Kenya. Those are our main areas that we're working, and then also with the refugee population in Washington State, so and mostly in HIV as well.
Thank you. Let's take one from the left side here, please. Go ahead.
Thank you. Hi, my name is Lily Gutnick. I'm from University of Alabama at Birmingham. My question is for the panelists that work more in the non-communicable disease space, which there are several of you, and especially for any of the clinicians on there. As Dr. Glass mentioned in his opening remarks, non-communicable diseases have been more recent and more emerging addition to the global health space. And particularly for you guys that work in this area, and again, as I mentioned, the clinicians, how have you navigated incorporating this as part of your career, and especially balancing clinical responsibilities, and particularly in institutions or centers where maybe aren't as familiar with global non-communicable disease space? So curious to hear your experiences. Thank you.
Let me suggest we could begin with Dr. Agarwal, and then let's follow through. So very briefly, your responses. And please get close to the microphone.
Thank you, George, for the opportunity to comment on this. I feel like I have the best job in the world right now, and I didn't think that this kind of job was possible when I was a Fogarty Fellow in 2017. And so I currently take care of patients 25% of my time, which equates to 8 weeks attending on the inpatient cardiology service. The rest of my time is dedicated to my research as a global cardiovascular physician scientist. My job gives me the flexibility to travel as needed and spend several months a year abroad, particularly in India, where my research is based, as required. Again, this has happened as a result of excellent mentorship, funding from the NIH that has helped me buy my time to be able to work on these meaningful projects, and an institution that recognizes the importance of global health. I think we have a long way to go to continue to make these sorts of creative careers accessible to more academic physician scientists. But I've been fortunate to be able to carve this path out for myself with the help of many, and look forward to seeing how I can continue to do that for my mentees moving forward. Thank you.
Dr. Garcia, you want a brief comment?
Yes, absolutely. This is a particular challenge, particularly for the very procedural, heavy clinicians, particularly those who still have oral boards to complete, including myself. So in neurosurgical training, it takes 7 years to complete the training in the United States beyond medical school. And then it's about another 2 years for you to have the number of autonomous cases to present to the oral boards here in the United States. So balancing this is incredibly difficult for many proceduralists, particularly surgeons, because most surgeons face this. But like Dr. Agarwal just commented on, it's really about the institution and the leadership and your mentorship. I've felt through the Fogarty program, I've gotten tremendous mentorship, and I continue to get institutional support to be present here today, for example, and as my schedule dictates, with my clinical load, try to balance those efforts. But still, there are many things that I think are needed to support people who still must maintain a heavy clinical load in order to contribute meaningfully in other areas. I don't think there's any formula, and there aren't too many role models, particularly in surgery, who have made it seem very easy. But I think we're on the way, and I think there's more and more trainees coming through, particularly this pathway. During my own fellowship year, there was another Fogarty fellow coming from the Vanderbilt Consortium who is also on her pathway to an NIH-funded career, and she's a pediatric neurosurgeon. So it's not a lot of folks, but we're out there, and we're always happy to talk to people and try to encourage them to join the career because it's incredibly invaluable, I think, to the global dialogues.
Excellent, thank you. Maybe a final brief comment from Dr. Nchia, because sickle cell disease is actually one of the remarkable areas where you see the full spectrum of basic science from newborn screening all the way to stem cell therapy, but remarkable work over the last several years in global health. And I was wondering, you want to make a very brief comment, if possible?
Thank you very much, George. So, as you said, and I said earlier, that sickle cell disease, for me, is a great genetic disease model. One, because it's highly prevalent in sub-Saharan Africa, and it was described many, many years ago as a monogenic condition, and now we have looked at many interventions coming through, from very basic newborn screening, therapies and like hydroxyurea, and we are now talking about gene therapy. And I think the support that I got from Fogarty and NHLBI was really, for me as a biomedical scientist or biomedical researcher, to work very closely with clinicians who are working and are seeing patients in sickle cell disease to better understand what is important in the clinical research that should be addressed from the basic science perspective. And I'm really looking forward to continue to work, and I'm really committed to continue to work on sickle cell disease to see that we come to a place where we have improved the health of the people with sickle cell disease in Africa. Thank you.
Thank you.
Dr. Nchia, I have a follow-up question for you. In contrast to many of our panelists today, your work is closer to basic science, to genetics, right? And your quote in page 49 of our booklet says, "It has made me hopeful to see that we have more scientists who can do research in the context of Africa." So my question to you was, how can this program assist to have more basic science and genetic researchers that are from Africa and that are living in Africa?
Thank you very much for that question. So that is correct. For me, this fellowship was really critical because it came at a point where I had just finished my basic science PhD research in sickle cell disease. And it was difficult to see how I could actually progress in my career to conduct meaningful genetic research to a meaningful disease like sickle cell disease for Tanzania and in Africa. And this fellowship proved to me that And I really tried to do everything within the country, and that I mean from the samples collected, analysis, sequencing within Tanzania, so that we can also build the local capacity to do that research within the country, within the continent. And through that, after me, there have been other fellows from Muhimbili University who have also continued to do basic research. We have Dr. Liberata Mwita, we have now a current fellow, Dr. Mohamed Zahir, who is working on looking at CD34 research in the lines of gene therapy, building the capacity for gene therapy in Tanzania, in Africa. So we continue to see that these fellowships are really meaningful for us to be able to conduct meaningful basic science research, which we need in our context. Thank you.
That's really wonderful. I think it's a real testament to the program that the Fogarty International Center has fostered over the years to see the full spectrum of basic science, fundamental discoveries, early translational research, behavioral science, all the way to implementation science. So I'm hoping one of the questions is going to be on implementation science. I'm really very proud of this audience. We have about 6 people in line, so please tell us who you are and your question, and we'll make sure we get to all of you. We take the one on the right.
Yep. So hi, I'm Craig Cohen, the director of the Global Health Fellowship Program. It's really great to be here with this esteemed panel. I'm going to ask a more fundamental question because we're always trying to make our programs better. And one thing we've noticed, and I wanted to get your advice, is that we've noticed over the last few years, we're seeing a decline in interest from U.S. postdoctoral applicants. And so, the world has changed since you completed your fellowships. We've gone through a pandemic. We see economic challenges. There's also this movement of decolonizing and democratizing global health, which is also affecting the role of U.S. institutions and therefore young U.S. fellows and then eventually faculty members. But I'm looking to you for some advice. And I also want to hear from our panelists who come from other parts of the world as well. What sort of advice do you have for programs and program directors, and how do we recruit the next generation of U.S. fellows? Because this program is unique in that we recruit just amazing scientists from our partner institutions around the world and also from leading U.S. institutions.
Hi, can you hear me? Yeah. Thanks so much for your question. I can speak a little bit on this. I come from an anthropological background, even though my primary background is in the biological sciences. And I would say that probably one of the most untapped resources that I think Fogarty could access are those in the social sciences. Individuals that I've gone to graduate school with and I'm colleagues with are doing field work all across the world for their research on everything from the politics of global mental health to memory and trauma in post-genocide Rwanda to HIV care in Thailand. And although these perspectives aren't necessarily amenable to maybe NIH-specific research questions, the understandings of local context, history, and politics is just incredibly immense among those who spend obviously an entire PhD focusing on those. So I'm a huge proponent, of course, of Fogarty, especially for those who are seeking dissertation and postdoctoral research opportunities to do abroad, especially with regard to capacity building and working with local partners. The question on decolonization also is a really important one that has been deeply rooted in the social sciences and humanities, and is one I think is probably within the forefront of our disciplines, especially with regards to global public health. And there are a lot of really critical perspectives that are being actively applied, not just in healthcare settings, but also the production of knowledge outside of, both inside and outside of the academy. And I think being able to work with social scientists who also very much are in NIH level researchers as well will provide a lot of different avenues and opportunities for health science researchers to expand their work, to understand the social and political as well as economic implications of their research, and possibly build more, I would say, locally contextual and hopefully effective interventions for improving health.
This would come from a perspective from Africa. I think the first time I was applying, it was a bit challenging for me. And I've talked to many colleagues, and they've had challenges with the application. For me, it was the US mentor, and people have all kinds of challenges. So I think in the closeout of my Fogarty, I had a recommendation. Maybe 3 months before the deadlines, if potential applicants can be invited for a webinar, and they can help them navigate through what is required, and just to make it simple for them and make it, because many people might think, oh, this is too complex, and these are the challenges, and sometimes people get challenges and they're not addressed, so they end up giving up. So for some of the programs, I've seen webinars just to orient people what you need to do, what you need to prepare, what the program is about, gets them excited, and sometimes increases their participation. Thank you.
Maybe if I could add very briefly, there are lots of times when challenges come up at the national level, many of us do not engage as well as we should. Some of us may not be able to, but those of you who can, it really makes a big difference when people with the background and training in that field are the ones who are addressing these themes at the national level. Let's not leave it all entirely to those who don't have an interest or don't have the expertise. I think COVID taught us this very well. The misinformation and the mistrust in science is really impacting our ability to grow the science and grow more people in the science. So hopefully more and more of us would get engaged and speak up at the national level to drive this. Thanks. We have several questions we would like to ask the panel, but all of you have been standing up, so please, let's take one from the left. Okay. And if we make it brief, with brief responses, we can get to all of you before Dr. Glass pushes us off of the panel for the next panel to begin. So please, let's go ahead.
Thank you. My name is Lillian Pinson. I'm a former fellow from 2014, and I'm a dentist. So my question is related. I'm one of the first dentists that was part of the fellowship, and it was amazing for me, for my career. But I want to hear ideas from the panel about how we can continue building our career pathway. Because like in my case, I had created a lot of things in my University of Utah, which is quite new. So it's easy for me to create everything related to global health. The issue I find is funding. Where can I find funding for all the things I want to develop? And so what ideas the panel has for, especially for Fogarty, because, you know, like we want to build further in these pathways that they're, you know, helping us with a seed, which is the fellowship. How do we do that to move forward?
Anyone who wants to jump in, please turn your mic on and go ahead.
Thank you for that question. So I am Ifto, and I'm working in Haiti actually. And I can take as example, one of my first study, it was to study the long-term modality among people with TB, among HIV positive people. And we showed that even completion of TB treatment, people more died higher than people that never got TB. And with the global health thinking, so you are not only answer a question, but you have to say what is next. So as the next step, so you're going to show, for example, for my study, so why people die higher than after completion of TB than people never got TB. And we think like actually we have non-communicable disease, cardiovascular disease, that may have an impact on that. So global health thinking, it's always think what's next. So even you get an answer for a question, you will always have another question to answer. And I think this is why global health is not like a job, but it's a career. So today you are juniors, so tomorrow you will be able to coach other new generation. And I think that even you get an answer, don't stay in that answer, so go away, go after the answer, and always think that if you want to have a well-being in the community, so you will always have another question to answer in order to improve these health quality for that population.
Can also contribute a bit. So with regards to career development, I think one of the lessons that I got for myself is sometimes it's challenging to first identify where you want to focus on. And I think that's really important to know what sort of impact you want to make. And then also identify within your institution who are the people that you can work with and who do they work with. And then see what kind of resources, human resource, but also other resources that you can leverage on in terms of partnering with colleagues within the institution and their collaborators to see where the gaps on what you want to address or where you want to focus. Thank you.
I wanted to add something to do with funding. If you look at the funding portfolio, you can see that you can apply for funding from other institutes of health beyond Fogarty. I can give and also outside for NIH to other funding entities. My project for Fogarty was funded through Fogarty, definitely. But then for my next project, I applied for the European and developing countries clinical trials partnership, which I got. And now for my next project, I'm going to apply to the National Institute of Mental Health. So it's like there are diversities in funding portfolios, and we should look beyond Fogarty to other institutes of health within NIH, but also other global funders. Thank you.
Thank you.
Let's take one from the right, please.
Okay. Thank you. My name is Sudha Shivram. I serve as the training director for the Center for Global Health at the National Cancer Institute. So we launched our own Cancer D43 some years ago, and so in many ways we are now where Fogarty was in 2004, I suppose. But I was directing my question to both Dr. Nkaya and Dr. Agarwal because you both have progressed on to an Early Career Development Award. So I just wanted your thoughts on what was the process of identifying your research question and transitioning from the one-year mentored research project to identifying a team that will help you move on to a K43 in your case, Dr. Nkaya, and K99R00, Dr. Agarwal, and others who may be in the same pathway. Would really love to hear, because that's where we want to see the progression eventually as an independent career. Thanks.
Very much for the question. So I think this is what I was trying to hint out from the last question. For me, really, as I said, I'm very lucky to have been with the sickle cell program in Tanzania and remaining working with them for more than 10 years now. So it was not easy for me to say that this is what I want to do. My master's was on drug resistance in malaria. And then I did my PhD in human genetics in sickle cell disease. And then at that point, you are even asking yourself, should I continue with sickle cell disease? Should I go back to malaria? Should I, all those questions. But I think I was very lucky to get into contact with people like Professor McCann quite early on in my career, who guided me through. And Professor McCann started the program in 2004, where there was a team that has been growing all these years. So for me, that interaction with the team, with different people, clinicians, scientists, early career, seniors, really helped me to nurture my dreams in public health, but also to identify the gap that I want to address. So for me, really, that mentorship, that contacts in the country, and also my own passion for research came together and assisted me throughout. Yeah, thank you.
Thanks for that important question. Intellectually, the research that I started during my Fogarty Fellowship was trying to answer the question of how do we improve care of our heart failure patients. These patients need kind of a suite of medications, at least 4 different classes of medications that can improve their morbidity and mortality, and yet we see large gaps in treatment of these patients worldwide. And so to answer this question, I piloted an in-hospital quality improvement intervention. And although we reached our primary outcome, it was still, the rates were abysmally low, which inspired the idea of a poly pill for patients with heart failure, which is what I'm excited to really spend most of my time thinking about these days. And borrowing this concept from HIV and TB and hypertension, where fixed-dose combination therapy has really transformed adherence rates worldwide. From a mentorship perspective, my Fogarty mentorship team, Dr. Prabhakaran and Dr. Huffman, are my primary mentors on my K99 application. And as my intellectual interests grew to clinical trials in low and middle income country settings, I expanded my mentorship team to include Anushka Patel, who is CEO of the George Institute for Global Health, and they lead large-scale clinical trials, particularly in South Asia and Asia Pacific. So I think that leap from the Fogarty Fellowship to a Career Development Award was very contiguous for me, both from an intellectual and a mentorship perspective.
Let me remind all of us that all of these panelists are still very, very early in their career, and they've been given such terrific responses. So let's challenge them a little bit more. So Dr. Agarwal, since you have the microphone, let me ask you, what advice would you give yourself, your earlier self, so that you would have even gotten a whole lot more from the program? Is there something else? If you were starting the program now, what advice would you give yourself, and what would you do differently? And we're going to ask all of you to chime in, because we'll be very, very interested in hearing that. Dr. Agarwal, you want to go ahead and start?
Yes, thank you for that question, and I'll be brief because I know there's many others that need to comment on this. I think the advice I would give myself is to relax a little bit and to pursue new ideas and take risks, because you never know what can come, and if you kind of follow your research question to where it takes you and are willing to take risks to develop kind of novel ways to tackle and answer your research question, it can open doors that you didn't know even existed.
All right. Dr. Garcia?
You know, I think being in an early stage, especially in a very surgical, busy field, the question that I always ask is how many hours are in the day? And I've been very academically productive over, the course of my residency and fellowship, my clinical fellowship and my research fellowships. But I agree with Dr. Agarwal. Part of life experience is also pacing yourself through the marathon of all that we do. And I'm hopeful, to succeed in all the metrics that are usual and conventional, but I also think that part part of it is figuring out how fast you're going to run the marathon and whether or not you can maintain that endurance so that the products that you have at the end of the day are the ones that you want to leave to continue to grow and blossom with other people.
Excellent. Dr. Joseph?
My point of view is, I will be very brief, but I remember when I started with the program, I had the lack of communication. I was always afraid. I had to communicate with others. And I think that it's a very key word that you have to keep in mind. Always don't be afraid to talk. Always communicate. And also, this is one of the management skills that you need, because you may be a very good leader, but if you are not able to communicate very well, so you will have a vision, but you will not able to share that vision with others. And you have to trust your team, and you have to share all your knowledge and communicate with your team in order to go in the same way and to go and beyond that vision. And this is why I have to say thank you.
Great. Dr. Karchevsky?
Yeah, just echoing on your comments, one thing that I wish I had done sooner during my Fogarty year was I wish I had been more confident in reaching out and communicating with people. There really wasn't too much of an oral research community where I was at, or even in the United States. So I wish I had reached out sooner to these different dental schools within East Africa to establish relationships, which could also go back to building clinical capacity to get dentistry to every community.
That's great. Dr. Kim?
Yeah, thanks so much. I would say for myself, I wish I communicated my research more. I wish I made more effort to export my research to different communities. I did this rather late in my Fogarty time during the pandemic when I started doing research on the mental health impacts of COVID during the lockdown and among those who were who contracted COVID. There was intense public media interest in the research, so we didn't export our results on a wider scale until the journal had requested that they write a press release on our paper, which was actually a paper that was funded by Fogarty. And because of this press release, I had like a flood of emails coming into my inbox from both local and international news sources requesting interviews and just, sound bits for radio. I was even on TV, and I had no idea what, it was the lockdown, I had to get my hair cut, there was so much happening, and I realized that the impact of my work was really just increased, 2-3-fold as a result of having my research more widely known. In fact, as a result of this, it motivated me to write my first op-ed on my own research, which also got picked up quite widely, and developed a lot of really exciting and new both research and practice-based opportunities for me with individuals I never thought I'd actually meet. So even just one press release or one op-ed opened several doors for me that have led to opportunities that continue to give today. So I would really encourage people to put even a little effort into communicating your research a little more. Thank you.
Great. Dr. Matuvu?
Thank you. One thing I've learned over the years and picking from my earlier career is the issue of essential grants writing skills. I just noticed that I had been part of groups that were conducting research and winning grants, but I hadn't written an application myself, and I didn't know how to write a competitive and competing grant. So it took me to go to attend an essential grants writing workshop to learn how to really package my application, and that is a process I started much later. I could have started earlier on, having been part of these teams that were publishing and, writing winning grants. But I realized sometime later that, if I had to win a grant myself, I needed to invest in how to write a competitive grant. Luckily, I attended a workshop offered by the Africa Research Excellence Fund, which is a fund in Africa that is supporting researchers on the African continent. And 5 days of training were enough for me to sharpen my skills in terms of how to write a grant. And this opportunity for the fellowship came about 5-6 months after I had attended that workshop. And when I applied, actually was successful. Thank you.
Excellent. Dr. Ntia?
Very much, very briefly. So for me, I think time management. I wish I could manage my time more effectively in terms of really producing publications out of my work. And now the advice that I give everyone that I work with is that there's no small research. Whatever you are doing, just start to package it in terms of manuscripts quite early on, because time really do fly. Thank you.
Excellent. Dr. Sagawa.
Thank you. Two things I'll tell myself. The first one would be to delegate and collaborate more. And this is something I struggled with, and I derailed a bit. It's a 1 year, and sometimes we get trapped. You're trying to manage the data set yourself, you're training people, you're doing all these things by yourself, and you end up getting burned, so you don't have time for yourself. And I think I would be able, if my younger self would set up a team I would work with, that I would collaborate with and help me do some of these tasks. And then the second thing I would focus on is having and focusing on lifelong mentorship. As I don't know, everyone's road is different. Mine was tricky because you get a mentor and sometimes you feel like it's a transactional relationship, like I've applied for Fogarty, it has ended, let's walk different ways. And sometimes you derail, you get off track. And if you stick sometimes, like now I meet with my mentor monthly, it helps sort of keep you focused and helps you sort of being active all the time, because early on I lost a lot of time in between one grant and the other. I got derailed, took a different career path and came back. So that's something I'd really work on. Thank you.
Thank you, Dr. Sagawa, and everyone else for your answers. I'm going to call on the lady on the right. Please introduce yourself and ask your question.
Hi, thank you all so much for being here today. My name is Melissa Salm. I am a GloCal alumni from 2017-2018, and I am a cultural and medical anthropologist. So behind you on the screen, it says Advancing Science for Global Health. In addition to science per se, which is obviously fundamental to global health research and capacity building, what else have you advanced through your global health careers, and what do you think we should be advancing for global health moving forward?
I can start. Thanks so much. Always great to see another anthropologist in these spaces. So, yeah, I think obviously the advancement of science is quite integral to the work that we do, especially given the fact that we work with colleagues who have very strong research infrastructure, or very strong research skills, but sometimes limited research infrastructures to optimally conduct the research. But I think part of the reason for that is because of these global inequities and historical limitations, and due to resource allocation as a result, of the legacies of colonialism, as well as these natural inequities that come up as a result of different power structures that privilege the perspectives of Western knowledge production. This is very much the case in global mental health research, where a large majority of global mental health research is done from people who are living in high-income contexts and not coming from those who are working on their own communities. I think this was also something that I was quite attuned to in my own Fogarty year, trying to understand how to produce science in a way that was both equitable but also lifting up the voices and experiences of those whose lives I was writing about and the people who I was working with. So I think in advancing science, we are also able to advance, people's careers, advance, public health in local communities by ensuring that the questions that we ask have deep impacts in the communities that we work with. Part of what was done in my Fogarty project was by creating a mental health surveillance program during COVID. I switched my research platform to create just a really, how do I say this? I guess informal but procedural process to triage different participants who had mental health crises in a context that had very limited mental health care resources, but also trying to find ways to create sustainable solutions for local community problems. This, for me, looked like collaborating with different NGOs, but also more political organizing groups who had a very strong understanding of these historical and political dimensions that led to mental health inequities in local contexts. So co-creating knowledge was something that allowed me to both advance science, but also advance capacity for folks to solve their own problems, especially folks who have much stronger understandings of the local context than someone like myself. Thank you.
Great, thank you. We have about 10 minutes to go, so we're going to encourage you to have brief questions and brief responses. I'll go to the lady on the right, please.
Sure. Hi, my name is Evelyn Shea. I was a 2004 Fogarty Ellison Scholar, 2012 UJMT Scholar, and current mentor in the Global Health Equity Scholars Program. Congratulations to all of you on your amazing work and all that you've accomplished during a very difficult period. I guess this session is entitled Moving Beyond Early Career, and I already hear a lot of elements from everything you've said about how the fellowship has informed you about the next steps. One of the beauties of this program is that it is hands-on and you're working so closely with mentors and role models. Can you tell me, and it can be for any of you, can you tell me a little bit about what you've learned about leadership during this time, either formally or informally? As you're moving through your career, you're probably already viewed as leaders within your teams, within your communities, and you probably haven't had a chance to really process that piece of it yet, but it's coming up. And so I'd love to hear what this year has given you in terms of those skills.
Excellent, thank you. Very brief responses, please. I didn't mean that brief.
I can comment quickly. What I find, as being a participant of this program and being a neurosurgeon, is I get put into leadership positions all the time that I don't expect to be put into, just because of the pure experience of doing what I've done and how I've done it, and just being very organic about the process. I don't think there's any formula, unfortunately, but I think there's a lot of different leadership styles, and the thing that you always have to ask yourself is, what is your leadership style that you want to lead by, and being an active witness to that in your own life. So I'll leave it at that.
Great, thank you. Another response?
I can contribute. Thanks for that question. I think running your own research study, especially in a context that may be somewhat new for you, is probably the greatest test of leadership skills. And I think sometimes being a good leader means stepping back when you need to. Of course, I was involved with coordinating different research assistants and project coordinators from my study. But sometimes I thought it was most appropriate for other people to step up and also gain their own leadership, develop their own leadership abilities by taking on new projects, which will also allow their own career development. And in terms of trying to be mindful about time and the allocation of energy and resources, learning how to delegate and know when to step back, but also know when to step up was something that I learned as a very valuable skill in leadership.
We'll take one from the right, please.
Okay, thank you. My name is Karen Gorleski. I'm the CEO of the American Society of Tropical Medicine and Hygiene and also a proud member of the board of Fogarty. First of all, I want to thank you for giving us all such hope. Every day there's another tragedy in the news, another bad report, and to see all of you in this bright future that you're presenting, it's really lifting. I'm sure all of our days, particularly, I'll speak for me, it definitely is a hopeful morning. I have a plea for each of you that you think of yourself also as an advocate. Fogarty has only been able to do what it's done for you because Congress has funded it and the American people have funded it. There is a huge lack of the connecting of the dots of where you got to where you are and why you're able to do what you do. So I'll ask you to think about this as another part of your professional responsibility in the people that you work with, your colleagues, your patients, your neighbors, your family, your local elected officials, to just add a sentence or two. I'm able to do what I do because of the Fogarty funding that came from Congress. And here's why it matters to you. That's 2 or 3 sentences that you just repeat, rinse, repeat, rinse, repeat, rinse, repeat, because the advocacy community, which is ASTMH, CUGH, Global Health Technologies Coalition, we work very hard to support Fogarty. But as a non-scientist and a non-Fogarty fellow, I can say it all I want, but it really matters when it comes from you. It takes all of us, so thank you.
Very well said. Thank you. Let's take one from the right, please.
Thank you. My name is Kola Matovu. I am a recent U.S. Global Fellow in Uganda, and my research has been around community-engaged research methods. And so I'm curious, for some of you who may have worked in communities in different settings, how, as junior researchers, how you continue to maintain community relationships with stakeholders, especially when you're not sure of your next funding and how that's going to transpire, how you're going to continue maintaining those relationships, but potentially could advance your research in those settings. So how do you foster those ongoing collaborations with community stakeholders and other researchers in the community? Thank you.
Comment briefly. So for me, working with the sickle cell program in Tanzania, one of the strongest initiatives we have is working with the patients' communities. And this is a major success because whatever we do, we eventually want to make sure that they understand they are the main stakeholders. So what we try and do is really to be working with them every step of the way, but also to empower them to be the ones to actually advocate for the research that we want to do. Because we need them to first understand, and they have the strongest voice to the government and the community itself. So we first work very closely with them, and then also try as much as possible to empower them to communicate together with us on what we are doing to the community and to other stakeholders. Thank you.
Great. We'll take the last question from the right, please.
Thank you. I'm Michelle Berry from Stanford and the Global Health Equity Scholars Program. And this is sort of a question that builds on Evelyn's question about leadership. And I realize that this is an incredibly biased cohort. You're obviously here for good reasons. But my question to you is, how many of you are actively mentoring Fogarty scholars now? If you can raise your hands, if you're... And for those who aren't, what are some of the barriers to being able to continue to engage with Launch?
I can speak as an oral health researcher. I think that there's been a disparity in Fogarty fellows and scholars that are from oral health research. So we've tried to get some people from the University of Washington, be it dental students or recent graduates, to get to them to be applying, but then they don't get accepted into the program. So from my perspective, that's kind of the first barrier, because I'm engaged in mentorship and other aspects of dental research, but it's just been harder with the global health aspect.
Thank you very much. This has been a really rich discussion. We want to make sure we get us all back on track on the program. And so I'll call on my colleague to say a few final words. But I wanted to share with you just a little bit of what I learned from this program. This has really been fantastic. The first is we all should relax a bit. Really important. Second, I learned communicate, really crucial. And the third is really cherish the relationships we have and nurture them. I also learned that time management is critical for all of us. Leadership and mentoring, critical. And then finally, for those of us who are not federal employees, or I say those of you who are not federal employees, advocate, advocate, advocate. We can't do that, but you can. Leo, over to you.
Thank you, George. I've also learned a lot in this panel session. I have seen a lot of knowledge and a lot of passion and a lot of leadership potential. I have never been in a panel before with former fellows, and listening to their stories and thinking about their path, I cannot but express my admiration for this program and for those of you at the Fogarty International Center that conceived it 20 years ago and that have shepherded it and evolved it over time. Thank you on behalf of the global health community and those of us that have been there in different capacities. This is a great privilege to be a fellow and a scholar of this program, but it is also a great responsibility. And we've heard different dimensions of how that responsibility plays out. We look forward to your leadership in global health in the present as well as in the future, in your capacity here in the U.S. or wherever you live. We look forward to continuing learning from your trajectories. Thank you very much for this panel. We are going now on a break, and I think we are reconvening at 10:40 for our next panel on a discussion with later career alumni. Thank you so much.
Hi, everyone. We're going to try to go ahead and get started. I realize people are still filtering in from the break. It's really good to be able to see people in person again, and I think we're all feeling that. But let's try to get started with panel number 2, which is entitled Then and Now, a discussion with later career alumni. So we're going to have a chance to feature people who've been trained through the Fogarty programs in earlier years and are at later stages of their career. And I think we'll probably hear some important similar themes from the earlier panel as well as some differences. Let me just start by introducing myself, and then Dr. Koroshetz will do the same, and then we'll proceed down the lineup just for some initial introductions before opening it up for questions, both from us as the moderators and also encourage all of you, just as we did in the first panel, to step up to the mic and ask questions, and we'll try to take those in flow. So my name is Satish Gopal. I direct the Center for Global Health at the National Cancer Institute. I should probably disclose a conflict, which is that I'm a former fellow. So I think, in truth, I think Anja and Roger and Peter didn't quite know where to put me on the panel, and that's very much understood. Let me just sort of briefly try to summarize kind of a few of my own threads just for context. And some of this is detailed in the booklet. Roger was nice enough to ask me to write a foreword for the booklet, and so you can read a little bit more about my personal experience there. But in 2011, Harold Varmus was mentioned earlier. When he was the NCI director, he created the NCI Center for Global Health, which, feeling that there was enough need and opportunity that this really required a dedicated and coordinated effort from the NCI. And we have certainly seen steady growth in our global portfolio as the largest funder of cancer research in the world since the initiation of a Center for Global Health in 2011. In 2012, Charlie Vanderhorst was already mentioned, and when he initiated the UJMT consortium, now led by Ben Chi, who's here, I was conscripted, encouraged to be one of the first fellows in the 2012 UJMT cohort led by Charlie. And it's really just because of that initial support. I was finishing at the time my medical oncology and infectious disease fellowships at UNC, and I think because of Roger's support, in addition to Charlie and Mike, they really helped me to conceptualize a career and make it a reality that I think I didn't have fully envisioned myself. In part by convincing me that it was possible, and in part by bullying our cancer center, who I think had a good deal of skepticism about the viability of this area of science and the viability of such a career trajectory, and so I'm always grateful for that. My Fogarty year became a Fogarty 7 years, so I lived with and worked with my family in Malawi as an NCI-supported physician scientist leading a large and I think rapidly growing cancer research program between 2012 and 2009. This included mentoring many subsequent cohorts of Fogarty Fellows who are now in academic global health positions. One of them spoke earlier today is Lily Gutnick, who told me earlier this morning, as a faculty member now in surgery at UAB, that they are part of one of the new launch consortiums, and she's sending a new surgery fellow to Malawi this coming year, which I think speaks to the multi-generational kind of impact of these programs. And I really had no reason to leave except for being recruited in 2020 to direct the Center for Global Health at the NCI. And Sudha alluded to this earlier, but we continue to consider our partnership with Fogarty around some of the training programs that they lead, in addition to our own cancer-specific programs at the NCI, as a really critical part of the portfolio, of our portfolio, to drive progress for global cancer forward. So that's a brief introduction to myself, and it was, I think, a lot of what was said in the earlier session really resonated with my own personal experience. So let me turn it over to Dr. Koroshetz, and then we'll go down and introduce the other speakers. So Walter, over to you.
I'm Walter Koroshetz. I'm the director of the Neurologic Institute, and it's a pleasure to be here for a couple of reasons I'll try and get to. So at NINDS, we have an Office for Global Health. It's run by Richard Benson. Involved with Fogarty for decades now. As we see it as an institute, not such a large institute, it would be possible for us to make good decisions about where to place people, how to get them the training and the support that they need. And we see Fogarty as having kind of blazed a path, and we're really happy to support people who are passionate about global neural health research to kind of follow in that path. And that, I think, has led to a lot of success of some of the people you'll hear about today. But clearly, we recognize the tragedy of the neurological, other brain disorders, mental health. Mental health, neurology in the U.S. is, there are walls between them, but those walls don't exist in developed countries, and that's good. But these disorders of brain and brain function, spinal cord injury, peripheral neuropathies, muscle diseases, they really rob people rob people of their ability to kind of function as they would like to in society and their families. And so we feel, it's really important for us to kind of do what we can to kind of bridge to these underdeveloped countries with some of the people who are trained here, and also to train people in the underdeveloped countries to kind of, blaze their own path. There is certainly no shortage of problems to deal with. They're really important problems for those countries. Some of them are also really important, research questions for us. So, if you want to study cysticercosis, which does affect people in the U.S., you probably don't want to do your trials in the U.S. You'd rather, be better off doing them in South America, and that's clearly what we do to try and understand better ways to treat, say, a disease like that. But also we recognize that the growing burden of brain diseases in undeveloped countries is moving more from the infectious diseases to the non-communicable diseases, and so we're really interested in being part of these countries' efforts to kind of attack these disorders in now and as they grow bigger in the future. And so I think, for me, the work that people are doing through Fogarty is just tremendously important, not just to our institute, but I think for our country. And so that's why, these meetings are always really a joy for me to join. We all go into our careers. We all have a story. I can tell you my story, how I got into neurology, but it's really boring. But these people have really interesting stories. So the people who go into global health, their stories, you don't forget them. And I think they're very influential to others to hear, just how they did what they did, because most of them, had to kind of fly by the seat of their pants and try to work out things, brand new things to make things work for them and for their research and for their to achieve their goals. So this is a great program because we get to hear the stories. And so we're going to go down the list here and ask people to talk a little bit about, how they got to where you are now, and what are you most passionate about, and what kind of advice would you give to folks who are kind of earlier in their career. So Richard, why don't we go right down the line, start with you. Oh, and before you go, so we're going to entertain questions. I guess maybe we'll go down the row, and because there might be some redundancy, and then we'll open the floor to questions. Richard.
Great. Well, thanks very much for having me. So I'm Richard van Zyl-Smit. I'm a professor of pulmonology at the University of Cape Town and deputy head of division of pulmonology at Groote Schuur Hospital, and currently serve as president of the South African Thoracic Society and co-chair of the American Thoracic Society International Health Committee, so championing global lung health. I was a Fogarty Fellow back in 2009 through 2011 and mentored by the late Bongani Mayosi and Professor Eric Bateman, and later by Agila Kaplan at UMDNJ. My Fogarty project, I have the distinct pleasure, I think, of being one of the few people that the NIH paid for my cigarettes. I looked at macrophages, tuberculosis, and tobacco smoking. So I was smoking in the lab, infecting macrophages with TB bugs. Subsequent to that, I've moved on to general poverty-related lung disease, as it affects many people in low middle-income countries, not only HIV, TB, tobacco smoking, and we have just seen the rise of a massive vaping epidemic amongst our adolescents, and I'm unfortunately at the forefront of fighting that. So that's kind of what I did and what I do now.
Thanks.
Thanks for having me being here. I'm Dr. Wei-Ming Tang from University of North Carolina, Chapel Hill. I'm associate professor of UNC Chapel Hill and also the co-director of UNC Project China. I joined the UJMT program in 2015 to 2016 and spent about 8 years in China for doing research in China, and my whole study team is currently still in China. My program in China is actually to promote STI testing, HIV testing, or other infectious disease testing among key populations, especially among men who have sex with men, using the social innovation strategies, including like cross-sourcing, paid-forward strategies. Some of them you may never heard before, like paid-forward, but we have using these strategies and think like these strategies are pretty useful and effective in different settings in promote infectious disease testing. I would like to share more later on. I will pass to you, Omar.
Hi, everyone. I'm Omar Siddiqui. I'm a neurologist and assistant professor of neurology at Beth Israel Deaconess Medical Center and Harvard Medical School. Also a visiting lecturer at the University of Zambia School of Medicine. I was a Fogarty Fellow in 2010. I initially went thinking I'd stay for a year, and I stayed for 11. That was under when Sten Vermund and Doug Heimberger were in charge of the program. My mentors was Igor Koralnik and Professor Mashri Potazanov, who was a neurologist, the only neurologist in Zambia at the time. Happily, that's changed. And Gretchen Burbeck, I'd be remiss not to mention her, who is on the Fogarty board and is really one of the pioneers of global neurology. My work was on HIV-associated CNS infections, meningitis, encephalitis, largely in the HIV population. And I'm a native Rhode Islander. Why is that important? Congressman Johnny Fogarty represented my congressional district, and I went to the same high school as Peter Kilmarks. Thank you.
Good morning, everyone. My name is Dr. Christine Sekaja Wiltshire. I'm from Uganda, the Infectious Diseases Institute, where I work as a senior research scientist, but my primary appointment is in the National Referral, Mulago National Referral Hospital, and I'm an honorary senior lecturer at Makerere University as well. My Fogarty Fellowship was between 2015 and 2016 under the UJMT Consortia. And my mentors were Dr. Yuka Manabe and Dr. Kelly Dooley, who was previously in Hopkins and now in Vanderbilt. And my research was really about tuberculosis, pharmacokinetics, and treatment outcomes, where we're exploring the association between drug concentrations and treatment outcomes, and found low drug concentrations and in most of our populations. And from there, it built onto the research that I later to do, which was really still related to drug pharmacokinetics, genomics, safety in TB patients and patients living with HIV as well, and just looking at those optimization studies like high-dose rifampicin and its safety and drug interactions with antiretroviral therapy. So my research has really been about tuberculosis, but has also expanded away from clinical trials and even going into programmatic research in programmatic setting, and a bit of implementation, how we can translate guidelines into practice. Thank you very much.
Good morning. I just wanted to give a quick thank you before I start speaking to the Fogarty staff that's been at Fogarty for a very long time. I was looking back at my email account to see when was the first time I got an email from Yolanda Thomas, and my phone broke at 2010, and I know that they're older emails. So my name's Eric Nelson. I'm a pediatrician. I'm a bacterial geneticist. I sit in the space between MD and PhD, and I was a Fogarty Fellow in 2005, 2006, and my partner, Ashraf Khan, is in Bangladesh, but we've been paired and working together ever since then. I've had the pleasure of being involved in leading studies in some way with participants prospectively, 43,000 patients I counted up yesterday, and interventional trials with more than 10,000 patients, and one of those studies was over 5,000 patients, and that was co-led with my colleague Ashraf Khan, who again was my Fogarty Fellow and incredible good friend. So I just want to advocate for his presence today. I want to anchor my thoughts around three words: advocacy, listening, and courage. And these words have kind of come out of my journey since I first joined Fogarty. In terms of advocacy, I was tenured last summer and became an associate professor at the University of Florida. And this is particularly important because this week is a week in which the tenure protections are being likely removed from the state of Florida for professors. And a lot of the advocacy skills that I learned as a Fogarty Fellow, I brought home to the state of Florida, and I leveraged those to navigate doing good science and good medicine in the state of Florida. And so that's a shout out and skills that I've learned through Fogarty. In that process, I also teach a class that was inspired by Fogarty on the ethics, the design, and implementation of clinical trials internationally. And part of that ethics takes me to my second piece, which is listening. We do sit in academia in a space that's often very apart from what people need and want, which takes me to 2010 in Port-au-Prince when I was co-managing cholera outbreaks in Cité Soleil, and we did an incredible job providing resuscitation and triage of patients during the 6 hours of the day that we could operate safely in Cité Soleil. But the other 18 hours of the day, we weren't there, and families didn't have access to knowledge and ORS and died at home. And so I had this kind of almost existential moment when I was finishing residency at Stanford, where I said I could do all the PCR in the world I wanted to, but I would never help those patients on those 18 hours off. So I began listening to what families needed in Bangladesh, what they needed in Haiti, and basically they needed better access to pre-emergency care. And so through that listening, we've developed a telemedicine and medication delivery service that operates every night from 6 p.m. to 5 a.m. for the last 4 years in Haiti, has expanded to Ghana, which George and I talked about, and it came about through listening, which is a skill I learned through Fogarty. The last piece is courage. And I was trained as a microbiologist. I wasn't trained in implementation science, software development, diagnostic development, but it was through the process of listening and thinking about the patient's journey through an outbreak and where the pain points are in terms of our failures. I began having the courage to bring teams together with diverse skills to solve problems in a systems way. So again, a skill learned through Fogarty. Thank you. You have your own.
Thanks, Eric. I think I'm going to be a little bit shorter, but I agree with all of those points. I think there's a lot that all of us learned from Fogarty. My name is Jackie Firth. I am a medical officer and the branch chief for the Pediatric and Maternal Clinical HIV branch at USAID here in Washington, D.C., where I lead a team of technical advisors who support U.S. government-funded HIV programs, primarily in Africa, but we do also have programs in Latin America and Asia. I am a proud member of the first cohort of scholars, which were known as the Fogarty Ellison Scholars, as we saw on that timeline. Quick shout out to my cohort mates, Evelyn Shea and Magali Blas, who are here in the audience. That was back in 2004 to 2005, when I was a medical and public health student at Tulane University. I did take a year off, so again, big push for anybody who wants to take a year off to try and figure out their life's path. Fogarty was a great option for me. I had the good fortune to match at Christian Medical College in Vellore, Tamil Nadu, India, where I worked with several amazing mentors, two of whom were based at CMC, first being Dr. Jessie Lionel, who was an obstetrician gynecologist who essentially saw all of the HIV-positive women who came to CNC, which was a very large delivery center. She offered them C-sections because at the time we had no ARVs to give them. And you can imagine the burden and the heartache that we saw on a daily basis. She had already started a knowledge, attitudes, and practices survey and HIV seroprevalence of the 8,000 women she had seen in the few years before I arrived, and I helped her to finish that project and write it up. My other mentor, who is world-renowned and maybe a name that many of you have heard, Dr. Gagandeep Cherry Kang, who is an internationally known virologist and expert in diarrheal diseases, particularly rotavirus. I worked with her on a project looking at the use of moringa, a local plant, to purify water. And talking about community engagement, one of the things we learned is the community was not interested in chlorine because they didn't like the taste. So listening to your audience is really important. They also, unfortunately, really wanted the moringa to work, which so did I. Unfortunately, it didn't. So again, learning about how to publish negative results was a lesson I learned. And I also would be remiss not to mention my three U.S.-based mentors, Ken Mayer, Christine Wonke, and Susan Kuuven. Ken is now at the Fenway Institute in Boston. Christine Wonke, I believe, is still with Tufts. And Susan Kuuven I still maintain a very close relationship with, and she is still at Brown.
Can you hear me now? Yes. All right. I'm Nazli Abedini. I'm currently a palliative care physician and an assistant professor of medicine at the University of Washington. I was a Fogarty Scholar in Ghana from 2012 to 2013 while I was a medical student at the University of Michigan and was mentored by Cheryl Moyer and Joe Kolars. My project at that time focused on applying quantitative and qualitative methods to really understanding the burden, outcomes, and perspectives associated with neonatal jaundice. And in the process of that, while I haven't continued my work in neonatal jaundice, I did have a profound experience that has impacted my career choice now, in that I was able to witness the experience of patients and providers as they navigated serious diagnoses, including death. And that has led me to my career in hospice and palliative medicine. I joined the faculty at the University of Washington in 2020 when I was able to connect with Joe Zunt, whom I'd met 9 years earlier in my Fogarty time. And together we realized a point of synergy in our interests, and that we wanted to improve palliative care training at the front lines of care delivery, and in this case, to stroke providers in Peru. And so since that time, we've been collaborating on several projects in which we're trying to actually advance the research capacity of stroke neurologists and stroke providers in Peru in actually assessing palliative care needs and ultimately trying to improve the delivery of palliative care in a context where there's very few palliative care providers and no palliative care training. And so our next steps are really to apply for a more formalized D43 grant in which we can form structure around this type of training to really enhance the expertise of our frontline clinicians.
Great. Thanks so much to everyone. I think these were some amazing people and perspectives that we've had a chance to hear from. We had some terrific questions from the audience, I think, during the first panel, so we just want to encourage and remind people that if you could make your way to the mics, Walter and I will try to field questions from the audience as we go, perhaps just to get things started and elaborate a little bit more on what we've heard already. We can just start with an initial question. So I think this panel is a little bit more removed from the Fogarty experiences in the earlier panel, and one of the themes that I think has emerged already is the important ways in which your careers have evolved. We've heard about a transition from neonatal jaundice to palliative care, from microbiology to implementation science, from TB to teenage vaping in South Africa. So I wonder if we could elaborate a little bit on that, given that this is a 1 year, fairly defined time, support that is typically received through the Fogarty program, how you all have been able to kind of evolve subsequently. It would be great to kind of hear some perspectives on that. And maybe we can start down at the end and work our way back to avoid, the same last person having to think of something new to say. So Dr. Abedini, over to you.
I appreciate that. I think one of the key factors in the evolution in my career and the many switchbacks that I've taken has been to really have mentors from the very beginning who have been dedicated to my professional growth, and specifically not trying to create me in their own image, but really trying to reflect back what they're hearing from me as my interests, my passions. That has really been the crux of this. And I would say that the three individuals I mentioned who are sitting together there have really been at the core of that throughout my years since I was a Fogarty scholar. So mentorship is really a key part of that.
I would absolutely echo that. I think that one of the things that I was joking to Erin Primack before this panel started is that I still have not escaped HIV. As a medical student, I was interested in this program because I was involved in advocacy efforts on HIV. Then I did a Fogarty year focused in a project on HIV. I chose my residency based on the mentorship that I had received through that program and have remained in HIV ever since, now helping to fund programs. So I think one of the things that I have really enjoyed is both the mentorship, but also the opportunity to find evolving ways to help address the HIV epidemic, and now looking towards the future, leveraging what we have built to address HIV in order to broaden that to address all manner of other issues, in particular COVID. And we have seen that in my work at USAID. Many of the partners that we funded to work on HIV pivoted and have been doing a phenomenal job to support the the COVID response in both PEPFAR and non-PEPFAR countries.
I think mentorship is a theme here. I benefited from mentorship from Steve Calderwood at MGH and Firdousi Qadri in Dhaka. Especially Shalik and Firdousi Qadri continues to be a strong mentor and advocate for the work we do. The other thing that I think is really important is that there's a distinction between medical tourism and building empathy. And one of the most important experiences I had to build empathy was in the cholera ward in Dhaka when I was on rounds and there was a child who had an ostomy without an ostomy bag and had cholera coming out of that ostomy. And I just thought about how wrong it was at so many different levels. And when I try to think about how I'm going to push through whatever barrier is facing me now, I often have those moments where I draw upon to find strength, and that's one of them.
So I think for me it's that one question usually leads to another. So, for example, I started out in more of clinical trial settings and pharmacokinetics. However, if you find that certain drug regimens don't work or want to do something about it, you can't do it outside on your own in a silo. So program or programmatic implementation became important at that point, and it was important to work with the National TB Program in answering questions that matter to them in terms of treatments, which treatments can work, which treatments they can actually implement. And I think that's how I evolved a bit into doing research within a programmatic setting. And of course, if you're working in a programmatic setting, then implementation science comes in. And now we're seeing, like, for example, new treatment regimens for tuberculosis, and now we're trying to see how do we adapt them, how do we now get them into program. If you're answering questions about how to increase TB case notification, the program wants you to go into the communities, then you have to find answers about to questions on how do you find TB in the community, what are the best diagnostics to use. So I think working with in a programmatic setting, and then working with the people who actually make guidelines has helped me to kind of evolve and get out of my niche and go to where they actually want answers to their questions.
So I think one of the things that helped me after the Fogarty year, and my Fogarty year the project was actually a 2-year project, and it was only 1 year, so it was actually hustle. You know, you just have to learn how to hustle. That was one of the greatest things. I don't know what my particular talents are, but I can take pain. I really can experience pain well, and I got rejected from so many things. And, you know, I can tell you, I got an American Academy of Neurology award, and a K award, and an R1. I got my R1 on my 6th try. So, you know, it was persistence. It was what I wanted to do. No one tells you when you start managing these grants, you're actually like a small business owner. You know, you're managing finances and people and all of these other skills. And so there's people who just like, I can't do this, and people who take it. So I think persistence and enduring pain and hustle, that helped.
I think to me, like the 1 year period for me is really like have 2 words can summarize. One is switching, the second is planning. For switching, to me, when I go back to China, when I get my PhD degree in the US, go back to China, when I arrived at Guangzhou, China, I was only like one staff and me in there. We want to program further, want to expanding, we want to have research programs, we want to collaboration. So to me, I really need to work a lot, to try to build collaboration networks, try to have all research programs going on. Eventually, have 5 years of growing, we have like more than 20 staff already. So that's a big switch time for me. For research, I think, at that time, I'm a dependent researcher, and somehow last year is a big change to me. I somehow need to become an independent researcher very soon, because at that time when I was in China, only Joe Tacker was working in China half a year every year, but no one in China is mentoring me. For me, I have to lead everything to becoming totally independent. So that's becoming like so important to hold my career. And the second point to me is actually planning. That year you really need to think hard what you can do in the future. What's your career plan? And if you want your programs progress well in China, expand well in China, have more research programs in China, and more collaborations, you have to develop and plan very well, by developing your career planning strategies, by working with different institutes in China. Yeah, fortunately, I was born in China. I know the environment very well, so that's my benefits, I think. Over to you.
Yeah, I think the Fogarty Fellowship provides you with a set of skills that no matter where you are, you just apply the same set of ask the question, prepare the grant, and do the work. I think as a clinician scientist in a country like South Africa, you don't have to look very far for work to do. And I think similar to Omar, I still haven't got my R01. But I ran into many walls of lack of funding, but as a clinician scientist, you just do what's in front of you. So what was in front of me was no smoking cessation service. So I started that, and as a researcher, I researched it. And so we published on that. And then there were no guidelines, so we wrote the guidelines. So I think there's a lot that you can do in terms of when you get stuck, there are natural paths. One of the challenges is that you end up being in spaces that you aren't familiar with, and there's great, I think, security in being familiar with your space. But then on the other hand, for those of you that know the TB world, there are some very big trees in South Africa, and so I needed to move out from underneath those shadows to grow my own career, and I wasn't going to get a career in tuberculosis, so I moved sideways. So I think part of it is opportunity, but the skill set that you've gained from a fellowship like Fogarty will sustain you, or will help you navigate that.
Thanks very much, everyone. And why don't we go to some questions? There's one here.
Sure, thank you. Well, congratulations to all of you for all the amazing work you have done. My name is Magali Blas. I am from Cayetano Heredia Peruvian University, former Fogarty Scholar and then Fogarty Fellow. And my question is about policy. So we know that research is important to evaluate the effect of the interventions. However, if our research doesn't have policy implications, then we made up with a wall that doesn't allow us to benefit the population that need these interventions. So I wanted to ask you if your research has had, or you think will have, policy implications, and what is your perspective around it?
I approach my research like the question ultimately, and I think it's a good exercise, what's the mission of it all, really? What lays at the center of this? And at the center, what I think about it for me personally is reducing neurologic disease in Zambia. That's what I wanted to do. And that one of the opportunities was Fogarty is a great opportunity to get me in that environment and then to do research around it. But it also brings dollars to build other people up. And so one thing that was, I think, the greatest success of the program that we've had in Zambia is that the thing I recognize is like, well, if I can do this work there, certainly a Zambian can do this work there. And so we developed a training program, which wasn't totally in the purview of what Fogarty had in mind. But these are people that now we have Zambian neurologists who are going to see the policy implications of the work and then go in Ministry of Health and then can advocate for change within the country itself. So it doesn't necessarily have to be a paper publication that leads to a guideline that then leads to policy change. I think we've had the most effect, I'm not saying this is correct, it's just one way, of really building people up within the country who then take it over and then are really in a better position and should be the ones to move it forward within the country.
A question on the other side?
I was going to add to that, if that's okay, because I think this is maybe one of the most important questions of the day, which is revealing an opportunity, I think, for Fogarty, which is for about a decade, I felt frustrated because my research wasn't finding its way to policy. And I was sort of adrift and having a hard time finding out how to engage with policymakers. And it wasn't until I joined a branch of the WHO that deals with cholera that I was able to transition my science to people that were going to make policy. And I'm wondering if there's a mechanism by which Fogarty can better engage people in policy making so that we can form that partnership early and save, in my case, a decade of kind of wandering.
Can I just further that comment to say, I mean, the challenge always is with politicians is they don't listen to you without data, and they may not listen to you with data. But at least if you have the data, you have a better chance. And so I think it's critically important that as scientists you become advocates both for funding but also for policy. How much they listen, I think, depends on how much money they're being paid by other people. But I think the numbers are always important.
Question over
Thank you. Lily Gutnick, University of Alabama, Birmingham. A question for anyone on the panel about mentorship. So as it has come up, mentorship has definitely been a very key to success in your career trajectories. I'm very lucky to have Satish Gopal have been my mentor when I was in Malawi. And I'm curious more in transition as you advance in your career from being a global health mentee starting in your Fogarty years to now probably being global health mentors to a lot of mentees, even possibly Fogarty mentees, and how any pearls, pitfalls into that transition, and specifically dealing with mentoring trainees at various stages, whether they're students or residents, and then mentees coming from different places as well, U.S.-based mentees interested in global health, as well as mentees from LMIC partner sites. Thank you.
So I think that mentorship begins as soon as we get whatever qualification we're aiming to get. So whether it's your undergraduate degree, actually it could even begin earlier on, but I think what did it is when I started doing my PhD program, I was mentoring master's students. When I finished my PhD program, I was mentoring PhD students and postdocs as well. And I found that when people know, for example, I do work in tuberculosis, they'll come to me for tuberculosis in any field. They won't care that I was doing clinical trials at the time. So someone will come to me with social sciences kind of questions, implementation science, integrated multimorbidity of TB and cardiology. So I think that helped me broaden my network for mentorship, because you don't necessarily need to be a cardiologist to be able to mentor someone doing work in cardiology. I think the basic set of skills in research that you can get from a program like Fogarty will help you be able to mentor anyone in any field, just because you have basic steps. So that's one thing. Being a mentor has also taught me a lot. I think we learn a lot from our mentees, and we become many experts in small other fields, or it seems like we're experts in other fields that we actually may not know anything about because it's one of our mentees actually working on it and not ourselves. But that broadening our knowledge because of the people that we're mentoring has helped me a lot, because that has what's built my network. And you mentor one, and then one leads to the other. I think since I finished my Fogarty fellowship, I've mentored about 7 Fogarty fellows, and that's just under the Fogarty fellowship program. So we also have our programs for our university, and then other programs like CIFA. So my network of mentees is very vast in terms of topics, even outside TB. So I think that is key, that we keep open in our mind and just apply the basic skills we've learned in whatever area we can mentor people.
To me, I think mentorship is kind of a paid-forward strategy. What we call paid-forward is if you go to a coffee shop, you want to get a cup of coffee, but the cashier might tell you, okay, this coffee already paid by the previous customer, and you can take this coffee for free, and you can, in the meantime, you can do less money to pay the next people for a cup of coffee. But actually, for mentorship, it's the same idea. We learn so many things from our gracious mentors, like leadership skill, like research skills, writing skills, etc. And this will let us to grow up, and eventually will take the burden of becoming to pay over mentorship to the next generation researchers. That's what we have done in China too. When I was in China, I received so many mentorship support from our mentors, including Mike Cohen, who is also here. This kind of things led me to becoming really becoming an established researcher. And when we have becoming an established researcher, we want to pass these skills. We want to pay these general things to our next generation researchers. So I think we are taking the burden to move forward. Yeah.
On this side of the question?
Just following up on mentorship. As early and new investigators, sometimes we meet challenges and sort of, for lack of a better word, hide from our mentors. Sometimes we are behind on our manuscripts or projects we're supposed to write. And sometimes it's helpful when mentors look out or search for us and help take us out of that hole that we're stuck in at some point. So is that something you look at, and maybe what's your experience with mentorship, most especially with the non-perfect mentees who sometimes disappear and then reappear? Yeah, thank you.
I'm happy to respond to that. I think one of the key things as a mentor is being able to assess your mentee and determine is there lack of engagement or their inability to finish this manuscript or just a barrier to their progress. Is that because of the mentee themselves, a character flaw, or is there something else going on? And 99% of the time, it is not a character flaw of the mentee. It's really something that can be improved through a mentorship intervention, such as mentoring around time management or expectation management, or potentially getting extra help to help someone complete a task. And so what I like to encourage in my mentees, and this is something I've stolen from excellent mentors that I've had in the past, is to really create a safe space in which that type of information can be exchanged, where a mentee could come to you and say, I'm really struggling in meeting this timeline, and I'm hoping you can help me in figuring out how I can achieve this goal or set a more reasonable timeline to complete this task. Because ultimately your mentors, they do care about your products, but they care more about you as a person and want you to succeed as a whole person.
Yeah, if I can just add to that, I think that we need to distinguish between a project manager and a mentor. And I think there are very bad mentors out there. And sometimes the problem is not you, the problem is your mentor. And so it's useful to have two. I always say to my students, you need to have two people, because if one is a disaster, at least you have someone else that can help you out. But I think we learn from our mentors the good stuff and the bad stuff. And if my mentor does this and this, which I really don't like, then I need to take that on as I become a mentor and make sure I don't follow that through. But I think the project manager person is there to get the project done, and the mentor is there to look after you. They may be the same person, but I think you need to be very clear what the person's role is in your life. If it's just to get the project done, then that's great, we do the project. But if it's a career life mentor, that's a very unique person, I think, and those are hard to find.
If I could also add that I think as mentors, it's good to recognize that we're not creating clones of ourselves. So I think I learned that very early in my mentorship, trying to make people exactly like me, that because I applied for this, you have to apply for it. Because I went through this training, you have to go. I mentored this person, you also have to. So recognizing that our mentees are not clones. I was mentored by someone who took me up right when I was doing my residency. That was Yuka Manabe, and I think I owe a lot of my career journey and just my perceptions towards research to her. She linked me to someone who was more in the pharmacokinetic setting. That was Kelly Dooley, who I've continued to work with up to this stage now. And I think having that kind of mentors who allowed me to explore and not just duplicate exactly what they've done, and also mentors who told me as it is. I appreciate that of Yuka. She told me as it is, and many people don't appreciate that. But I think having someone who tells you as it is, if you're going the right way, they tell you, and they don't try to cover it up or be too polite all the time. I think sometimes we need people who will just shake us up and say, you know what, you're not being productive, you need to become more productive. So I think a balance of being, of understanding we're not cloning, but also understanding that there needs to be productivity, and taking note of people who might have at different points of their lives when they have challenges, and going slow at them during those times of challenges.
So we have a number of questions waiting, so we'll try to get through as many of them as we can. So maybe we'll move to the right side. If you could just introduce yourself and ask your question.
Hi, I'm Chris LeBeau. I'm going to be a fellow this next year with ICDDRB. I had a question around the conversation that was being had earlier around convincing policymakers to make change. In many situations, and even in, looking at the U.S. as an example of this as well, just because something or there's knowledge about something does not necessarily mean that there's going to be policy action, or policy is not necessarily able to be implemented for action to be taken place. And so I was just wondering about your experience with like power mapping the situations that you're in, and the other ways beyond policy that you see your work having an impact or a way to be implemented when policy is not necessarily a solution.
Great, thanks so much. Are there one or two panelists who want to speak to this question? Yeah.
I can speak to that one in terms of looking at things outside of policy, because I no longer do research and I'm not writing the policy, but I am helping to advise on programs that are basing our guidance on the research that is put out by, again, many of the folks on this panel and other places. Much of it is NIH funded. So again, I think that we do want to ultimately have our policies reflect the best science and the best evidence, but even before sometimes the policy gets there, we are able to implement that with our programs, particularly the U.S. government-funded HIV programs, because we have suites of technical advisors who sit here in headquarters and also in all of the countries that are looking at that research, recognizing what are the best drugs, what is the best way to implement this program, and not waiting for potentially WHO normative guidance or even country policies to change. Again, we don't want to be ahead of that in terms of conflicting, but if there are things like moving to dolutegravir as the first-line treatment for people living with HIV, we can, again, help to push through our programs doing that at the same time as working with those larger bodies to change the policy to reflect it.
I can add one short point. I think, beyond the points all mentioned regarding the policy, I think one point is actually choose your collaborators. When you try to choose the right collaborators, sometimes even there was no policy for implement the idea, the collaborators can still get implemented in the large scale. For example, when we promote HIV self-testing in China, in Guangdong province, the province with 120 million people, we do not have a policy to promote this, but when we choose to work with the CDC, and the CDC finally feel that, it's really a good strategy and promote lots of case finding, they naturally adapt it. And I think this is like a literally way to not need to have guidelines, or if we have guidelines, that's better. But if we choose our right collaborators to promote the program further, that's also very important.
If I may also add, collaborators can really be interpreted broadly. I have found that sometimes the most compelling stories don't come from physicians or from scientists, but actually from the patients themselves who are affected by these ailments. And I have found that partnering with them as advocates is a very successful means to sway folks who have control over some of these structural issues that we're trying to change.
Terrific. Maybe we can move to another question. I think sure, we'll go to this side then. If you could introduce yourself and ask your question.
Thank you so much. My name is Anuba Agarwal. I'm a former Fogarty Fellow from 2017. This question is for any of the panelists and or the moderators. The COVID-19 pandemic has really changed some of the mechanisms and processes by which we do global health. With the rise of teleconference tools like Zoom, we're leading an international research team from either New Delhi, India, or St. Louis, Missouri is now possible. What advice do you have for Fogarty and international research training programs for navigating kind of the future of global health and these new ways to do global health research, particularly in the face of the rising threat of climate change, which international air travel can contribute to?
That's a terrific question. One or two perspectives on that from the panelists?
Well, let me go for someone who lives out of the US. Don't forget to go and see the people. At least one aeroplane flight I think we could manage. I don't think you need to have the I'm there every week. But you can't do global health research on Zoom. You have to be on the ground seeing the people, maybe not every week like we used to, but you've got to be there, you've got to see the people, you've got to understand the situation on the ground. Zoom is very helpful to set up and to problem solve, but you can't not be on the ground.
I would just reiterate, as someone who repatriated a little less than 2 years ago, I mean, there's no substitute for being in country, as Richard said. So I do it. I have a team there, but you don't have the pulse on the relationships. And so, you know, I think in Zambia, we have a really good weekly educational didactic series and research methods and neurologic disease that actually goes throughout sub-Saharan Africa, and that's via Zoom, and that's great because then people who, you know, there are countries that don't have neurologists that are part of these and get research methods and they get mentorship, and it's all on Zoom, and it's a whole curriculum that my colleague Deanna Saylor has spearheaded. So for that, I think it's great, but I don't think anything is going to be replaced being embedded.
I just want, during the COVID pandemic, we tried to, we actually did conduct a clinical trial. We conducted a clinical trial on chloroquine in our patients earlier on when people still didn't understand whether it worked or not. So one of the questions was, how do we collect data? All our patients at that time were treated in a COVID treatment unit. They were isolated. We need the CRFs to come out and do QC. So there was a lot of issues about, in an LMIC setting, how to collect data and still remain safe on the outside. So we explored tablets. We couldn't do tablets because we still have to come out with them at some point. And then we became creative. So we used the CRFs and then actually put them into, I've forgotten what we used, but used heat and sprayed them. And then we would try to innovate to just make the CRFs less infectious when they came out of the room, and then kept them in the CTUs as much as possible. So I think this comes to LMIC, that we need to find new creative methods of collecting our data. Surveys are conducted on phones, emails, but we're not there yet. We still have to sit down with the patients and with a piece of paper and tick boxes and write on that. So I think this teaches us at LMIC we need to move to adapt new tools to collecting data, especially in settings of highly infectious pandemics.
I think the next question is from Stacy Chambers from the NINDS Office of Global Health. Stacy?
You stole my line, Dr. Korshitz. Be interested in hearing from the panel. You've had tremendously impactful careers. If you could go back and change or add to your fellows and scholars experience, what would you add?
I'd add something really important to the curriculum, which is being intentional about training in the tools of leadership and mentorship. There's a great scholarship and literature and methodology to this. And I don't know why, but about 4 years ago, leadership books started showing up around my house and around my desk. And as I read, I really wished I had had training and had read a handful of leadership books back in 2005, 2006. My daughter's in an all-girls Boy Scout troop, and I look at some of the leadership skills that they're training in her troop, and those skills I wish my undergrads had and my grad students had, and I wish that we had leadership training not only in Fogarty, but embedded in undergrad and high schools. So that's my answer.
Anyone else? Yeah, Dr. Firth, want to add something to the Fogarty training and model?
Sure. This is actually not something I would add, but something that I'm sad that seems to have gone away, which was the twinning that was mentioned in our program. So in our first class, we were matched with a fellow from another country. And I was lucky enough to actually go to India with another U.S. fellow. And the four of us were very close and remain close to this day. And again, our paths have crossed. Many different things have happened, but that entire cohort still, we cross paths in so many different ways. And I think that that was an incredible aspect of the program that I really appreciated. Even though I know the intention was for us to continue to work together on research, that hasn't necessarily happened. My twin actually is currently in the United States starting a sickle cell research center in San Diego, and she is an Indian doctor. So again, we've stayed very close, and Fogarty has had a huge impact on both of our lives. and I'm a little sad that not everybody had that. I think the mentorship is an incredibly important part, like we've talked about, but I think having lost that twinning aspect I think something got lost there.
Great. So we have a little less than 10 minutes and want to make sure that we have ample time for closing from Drs. Vermund and Kilmark. So maybe we'll try to get through a couple more questions from the audience. So maybe on this side, if you could introduce yourself and ask your question.
Sure. My name is Peter Jackson. I'm a 2019 Fogarty Fellow. I think a lot of us that were Fogarty Fellows get moved into leadership sort of global health positions because it's a small world in the institutions that we go into. And I wanted you guys to kind of expand on advocacy, but advocacy within the institution for how they really provide resources to global health. And then any advice you have for us who are getting sort of newly appointed into these leadership global health positions about how you kind of protect your time while you're hopefully going towards something like a D43 or larger grants. Thank you.
Well, I will say it really just comes down to talking to a lot of different people and finding a place that really values what you value. When I applied for my first faculty job, it really was challenging to find people who would find a place of alignment with the things that I was interested in and who were willing to protect my time while I developed something new that didn't exist. And ultimately, I chose the University of Washington because they were willing to protect my time so that I could start something from nothing. And so I think that it really comes down to something we've already alluded to, which is really having an ability to be persuasive with your communication about what it is you do, what your vision is for the future, and having at least a plan of how you're going to eventually get support for what you do, and then just hoping that they see that point of alignment. And I will say that I have colleagues who made different choices about where they went for work or for additional training, and when they worked in environments where there wasn't that support, it was really difficult for them to thrive in the things that they were passionate about. So that's really, I think, one of the key matters, is your negotiating skills.
I was just going to add that there are so many people out there that have opinions about global health that have no idea what they're talking about. And so really to just tune out that noise, and my favorite anecdote of this is I wanted to do it at my department had no global health presence whatsoever. Kind of a Boston Brahmin program, no offense, Dr. Korshev. So anyway, my chair, after I did it and lived in Zambia, came back to me later and said, I just didn't believe it. I didn't see how it would happen. I didn't know, he proved me wrong. But I knew he didn't believe me. But I knew it was a field. Do you know what I'm saying? So I was like, okay, you're very experienced, but you don't know what you're talking about. And so, there are a lot of people that offered all these opinions, and be really careful. And you can do it in an environment that doesn't support it. But yeah, I think just be careful who you listen to.
Maybe we can take a question from that side. Yes, please.
Good afternoon. Good morning. My name is Neil Tutla. I'm really happy to be here. Washington University in St. Louis, part of, actually a current fellow in the Fogarty training program, in the Achieve training program at Washington University. And my question is, all of you clearly have successfully navigated all of the challenges to get to where you are from the days you were trainees or fellows. My question is, what are the things that you would advise current fellows and maybe future fellows not to do? We've heard of things that to do to get to where you are. What are the things that you would advise not to do to help us get to where you are? Thank you.
I saw somebody write, "Don't give up." I think that might go a long way, right?
Yeah, and I think I would add to that, don't take on too much. Take one thing on at a time. Enthusiasm is fantastic, but it gets you into trouble. So don't let your enthusiasm run ahead of your capacity.
I would like to say spend more time persistent, as similar as yours. But in the meantime, try to stronger your collaboration network, because you want to get support from multiple people, not a single people, to solve the problems you may meet. Yeah.
When I won my first grant on my own, not on my own because we always use as a team, but the one that I was leading, I think after a while you think that everybody gets the grants that they apply for, but I did a timeline of all the grants I've ever applied for, and I think there were probably 100 different grant opportunities. So when people see one winning one grant, they don't know you're talking about a hustle, the background hustle that happens before you win that one grant that one is celebrating. So that don't give up. When you see people with 1 or 2 grants, you don't know that there are 100 other failures in the background. So that failure, if you don't win the first time, I wrote a K43 once, twice, thrice. Benchy helped me refine it, I remember, but I didn't get it. But a year ago, I got an RO1. So those background failures, people don't see, but don't give up on that.
I was going to resonate that comment, which I remember in medical school learning that you can't be happy and sad at the same time. And I think the same thing is true about judging yourself around, are you succeeding or failing? I think it's a big trap. Don't get caught in perseveration on that question. What you should be asking yourself is, are you learning? And if you have that mindset, you will succeed.
And I'll just add quickly, don't expect to finish everything in 1 year. We were discussing earlier about, having some patience with your mentees. So again, I did the program as a medical student. I had this great idea that I was going to do 2 projects, finish them, write them up, and tie a bow on it by the end of the year. Didn't quite manage to do that when I got home, and then my school was destroyed by a hurricane, and then I started residency, and so I finally managed to finish those publications, but it was 5 years later, so did it in the end. But I think that setting yourself up to recognize that life happens, so you will accomplish as much as you can in that first year, but expect that there is actually opportunities in the fact that it will probably take you longer than that 1 year to finish anything you start.
So since we're amongst family, and let's see if we can get to these last 2 questions briefly and then try to close out. So over to you.
Thank you. Very inspirational, all of you. I like the balance of both the good things and other things to look out for. My name is Sikhulile Moyo from Botswana. I've been raised in Fogarty since 2004 as a scholar and formerly Global Health Fellow 2017 under HBNU. When we started our Fogarty, we had amazing training and exposure. But one of the things that kept on being taught was this life-work balance. They said there's nothing like work-life balance. But after having gone through what I've gone through, my experience is not the same with all of you. But I wanted to know, how did you manage to maintain family life balance, the realities and challenges of pursuing a scientific career with all this, the need to be on the cutting edge, be competitive, win grants, manage teams, and also manage your families for those who have families? Thank you.
Can I take this one as the palliative care doctor in the room? It's an excellent question, and I would say that this is a lifelong struggle for all of us, is finding that perfect balance. What I would say is that at regular intervals, it's important to reassess your own values. What is most important to you and what gives you most meaning in your life? And that's not just in your work life. And when I do that, I'm able to very easily create a hierarchy of this is where I need to prioritize my time. And it also makes me feel less bad when I don't get to some of the things on that list that are lower down. And so that's something that I think is really important to do. And it's also helpful to have others who can advocate for those needs when you're not able to do it yourself. So making it known to others what's important to you and having colleagues who support that is really important.
So can I comment as one who wrote the book? They don't award Nobel Prizes to dead people. I didn't get it right. I got into major trouble in the middle of my career. I'm getting it right now. So you won't get it right all the time. But if you're getting it wrong, you need people around you to point that out to you. And you can still get it right later on.
Also, you may need to find a good partner or good spouse to help you.
I was one of those who had a baby. With every degree I got, I had a baby. I had one during my residency, one doing my PhD and one doing my postdoc. So I think one of my mentors told me, learn to juggle your glass balls. So at one time you juggle, one throw one out, another one becomes a priority, juggle again, one, so there's always something that's important at a certain time, and I think it's good to recognize what's important at that time. I didn't stop my life because of my career, but it's been hectic, and I think having a supportive environment, supportive boss who understands if you have to take your child for immunization, supportive parents who can babysit when you're in the DC giving a speech. So I think that support environment and supportive boss has really helped me through.
I'll just add, I see Benchi in the audience, and so I had a kind of an idyllic experience raising kids in Zambia, and because you had a lot of help, and we didn't have two salaries with one going directly towards our healthcare our child care provider, and so living overseas, it would just kind of was like I didn't work a night or a weekend for 10 years, That doesn't happen in the States with all the competing things and the sports clubs and whatever. So, I just, living that's one of the advantages. Some of these places, the little health work was so meaningful, and yet the quality of life was actually quite high.
Karen, you've been standing for a while. You want to ask the last question since we started the session a bit late? So.
Just a comment about the finding your people and finding your place. I'll give a shameless plug for the American Society of Tropical Medicine and Hygiene and CUGH. These professional organizations are where your people are, and I've heard that phrase time and time again. I've been CEO of AS2MH for 13 wonderful years, and I've seen a real shift in just those 13 years of what the annual meeting offers. More networking, more connecting. I mean, the science is always going to be there because it needs to be there, but the gathering places, the people finding themselves, finding support, finding that nurturing place, these professional societies offer that lifetime home for you. Plug over.
Thanks so much, Karen. Walter, any final comments as we close?
Well, I think as advertised, we heard some really good stories, and really appreciate you sharing your stories, and I think they're going to motivate and help a lot of people in the audience, and even some of the Boston Brahmins. Thanks.
This session has made me want to do a Fogarty Fellowship again, so I'm going to turn over to Sten, I think, for concluding remarks, and then Peter. Thanks, everyone. Thanks to our panelists.
So I'd like to invite Dr. Stenverman to come up and share some concluding thoughts. And also I would like to take this opportunity to thank the moderators and the panelists for engaging in such interesting discussions. It definitely has given me much to think about.
What an extraordinary morning. It's been an exciting time in global health research. We've got new drugs for tuberculosis, for neglected tropical diseases. We have mRNA and other new vaccine technologies. The M and E health world with digital tools is absolutely extraordinary. I remember posting one of my colleagues to a remote part of rural Mozambique where she literally had to hike 2 miles and climb a hill to get about a 30% chance of a cell phone connection. So we had a 30% chance of talking to her when we thought we could. That changed radically over 5 years through private sector and through the development of rural cell phone technology in Mozambique. Surgery and anesthesia, trauma is now considered primary care for low and middle income countries. My near-death experience overseas was resolved by a surgeon. Poly pills for NCDs, ultrasound machines that cost $60. It's just miraculous what's happening. You know, HIV drugs cost 1/100th what they cost when I was starting to treat HIV in the late 80s. We've had amazing achievements in reducing maternal and infant mortality as one of many metrics, and increasing life expectancy with a couple of exceptions with HIV and what's happening in our country in the United States. Now, at the same time, it's hugely challenging, and panelists have alluded to some of these issues. We have anti-science and anti-vax sentiments that are at a peak, anti-public health sentiments, where public health workers are perceived to be enemy. We thought we were going to be doing global diplomacy with soft power, and now we're investing more money into armaments than we have in any time in the last 30 years. We have a collective realization that we do not communicate our science and our worth effectively enough to lay audiences or policymakers, and we have to fix this. We don't have an NIH director, and this is odd. You know, one of the most influential science policy and management positions in the world remains vacant. And if you believe the journalists, it's because dozens of people have turned it down, or at least have declined to seriously entertain it. So at the same time, it's an exciting time. At the same time, it's immensely challenging. I don't know. I feel like the fact that folks in this room and on our panels, and those of you in the audience who have done these fellowships, you have tackled the problems of vulnerable communities. They are afflicted with a whole array of challenges in infectious, non-infectious diseases, trauma, and the like. We started out with so-called tropical medicine in neglected tropical diseases, malaria, problems that were very much infectious related. But we have seen the migration to non-communicable diseases, which are now dominant problems in middle-income countries and many low-income countries as well. Fogarty, under Roger's leadership, pivoted in that direction, and that was vital for this program. I would say we still need to do more in mental health. We mentioned oral health earlier, and we're going to have to tackle climate change and health. That is going to be a defining issue in our next decades, and I'm happy to see NIH in general and Fogarty in particular paying attention to that issue. We have these diverse research methods, and keep in mind that, I don't know, when I was working at NIH from 88 to 94, a long time ago, you could not get implementation science attention. You had to hide it somehow and fund it somehow in a way that masked it under something else. Now there's an embracing of implementation science, a realization that if we don't demonstrate to the people who are paying the bills that we're actually making a difference in a real-world setting, maybe we don't deserve the resources we get as investigators. So the notion that you can't just discover, apply at the bedside, bring to practice. If you don't scale up and actually make a difference, you haven't completed that loop. And I think that's an exciting addition to the methodologic armament that we have. A lot's been said about mentors and quality of mentors. A lot's been said about the need to advocate at the policy level, to recognize the funders. I'm going to close by saying not enough has been said about our NIH colleagues. The FHI, I had a call with FHI this morning, the FIC folks, the Fogarty folks, and their partners in neurology, in so many of the ICs, have done such a good job advocating for us, have done such a good job building these programs. And you've had a number of folks, Ken and Aaron in the audience, Flora's here, Roger, Peter, so many of you, Bruce, who makes it possible for the money to flow. So many of you have advocated for us so successfully over these past 20 years. I hope we'll give a round of applause to our NIH colleagues. And one of them is poised to give the final comments. Thanks.
Thanks, Dan, very much for your continued vision and leadership for all of us. It's great to hear you share that. I'm Peter Kilmarks. I'm the acting director now of Fogarty, and just want to be brief and say what a fantastic morning this has been, and thanks to all of you. I think we can agree this is really a best buy for Fogarty when you think about our mission in terms of the partnerships, the research, the training and capacity building, even in the short term, how much this accomplishes, and we see over the longer term, this is really a program that we're very much planning to continue and to keep behind. I wanted to thank everybody. I think I can divide the audience into two groups, those who were former Fogarty Fellows and those who wish they were former Fogarty Fellows. So thanks to all of you, and those who wish they could be Fogarty Fellows again, Satish. But I really specifically want to thank all of the program leaders and the staff of the universities, of the implementers, those here in the U.S., those that are abroad, really just giving so much of yourselves to support these fellows and scholars and the trainees, and the thanks to all of you, including especially the current Launch Consortium and their leadership in taking us into new areas of promoting equity and diversity in this program. Really want to thank the other, as Sten mentioned, the other NIH institutes and centers and offices that support this, how important that is for the funding, of course, thank you, but really for the networking and for the opportunities, the career opportunities that you provide to people following their Fogarty time. I tell the trainees, you can't have a whole career with Fogarty. We're going to get you started, and then you really should continue your funding with another institute or center. You can come back to us at the end if you want to have a D43 program, but that connection and that support from the other NIH partners is so critical, and we're so grateful for that, including to our moderators. Thank you for coming today and spending the time with us and co-moderating the sessions. Thanks to our Fogarty staff, the Division of International Training and Research, and then our communications office that's been so key in putting this program together, putting the beautiful book together. It's quite a collector's item. Thanks to all of you fellows and scholars just for participating, for putting a year of your lives at risk and jumping into this program. And for many of you, it's really launched a great career in global health and global health research. So thanks for putting that time, that year in, and then especially those of you who've traveled here today to share your stories, your incredible stories. I also just want to give my special personal thanks to Dr. Roger Glass for his incredible leadership for Fogarty and really for this program, giving so much of himself to advocate with the other institutes and centers to participate. For each person, when we have the training and 100 trainees are here, he meets with each one individually and wants to make sure that they're going to be well connected and have the support and advice that they need. So we've heard about John E. Fogarty, the namesake for the Fogarty International Center, a fellow Rhode Islander, and I think he would, like all of us, if he were here and could see this, he would be astonished and ecstatic and very proud to see everything that's happened. So thanks very much to all of you on behalf of Fogarty and the Fogarty Center. We look forward to seeing you. This session's now closing, but we want to see you again. We have a CUGH session on Saturday morning. This will be another celebration of the 20th anniversary. And then on Saturday afternoon, there'll be a session and presentations by Fogarty Fellows. So please join us there. And I think as we've learned during the coming CUGH conference, as we've heard from folks today, we should relax, we should communicate and network, and we should advocate. So let's do that during CUGH and probably take that on as good long-term life advice. Lastly, let me just ask all the speakers to please come up on the stage, and we're going to have a group photo. So everyone who was part of the presentation, speakers and moderators, please come on up and we'll have a group photo. Thank you, and we are otherwise adjourned.